She had 30 seconds to decide whether to keep lying or let a man die. The monitor was screaming. The surgeon was frozen. 3 Navy operators stood in the doorway with blood on their boots and nowhere left to turn. Every person in that trauma bay had a degree framed on a wall somewhere. Years of school, boards, residency, the whole architecture of credentials that was supposed to mean something in a room like this. Every person in that trauma bay had just run out of ideas. And the woman in the corner, the one nobody looked at twice, the one who restocked saline bags and answered to anyone who snapped their fingers at her, she already knew exactly what was killing him. She'd seen it before, not in a hospital, in a ditch outside a burning village, at 2 in the morning, with no equipment and no backup, and a soldier who had maybe 90 seconds before his heart gave out for good. She saved that man too. Nobody here knew that. Nobody here knew anything about her. That was the whole point. Before we go any further, if this is your first time here, hit subscribe right now, because this is exactly the kind of story we tell on this channel. Every week, we bring you cinematic stories about ordinary people carrying extraordinary secrets, dismissed, underestimated, pushed to the margins, until the one moment that changes everything. Turn on your notifications so you don't miss what comes next. And when you finish watching, drop a comment and tell me your city and your country. I want to see how far this story travels. Now, let's go back to the beginning. Mercy Crest Medical Center sat on the outer edge of Harlow Falls, a mid-sized city in the Pacific Northwest that nobody outside of it had much reason to think about. The hospital was functional in the way most regional hospitals were functional: understaffed, overscheduled, perpetually short on parking, and long on institutional politics. The emergency department ran 3 shifts a day. The break room coffee was always burned by the time anyone got to it, and every physician above a certain pay grade had learned to protect their turf the way people protect things they're afraid of losing. Lauren Mercer had worked the evening shift there for 14 months. She was 34 years old. She kept her dark hair pulled back in a clip that had broken on one side. The hinge had cracked sometime in October, and she'd never gotten around to replacing it. Her scrubs were clean but not new. She wore no jewelry except a narrow silver band on her right hand, the kind of ring that didn't read as a wedding band but wasn't quite not one either. And nobody asked about it because she didn't invite questions, and people generally understood that without being told. She moved through the ER the way water moves through a crowded space, finding the gaps, filling them quietly, never making the kind of impression that lingered after she left the room. To Dr. Preston Caldwell, the ER director at Mercy Crest, Lauren Mercer was exactly the kind of nurse he preferred. Quiet. Compliant. Not the type to raise liability concerns in front of patients or question his clinical decisions in front of residents. He'd hired her through a temp agency 11 months ago and had kept extending her contract in 30-day increments, mostly because she showed up on time, made no demands, and never generated paperwork he didn't expect. He did not know her real name. He did not know that Lauren Mercer was not a name she had been born with, not a name that appeared on any document predating 3 years ago, not a name that meant anything except what she had built it to mean, which was ordinary and invisible and safe. He did not know that the woman currently refilling IV bags in Bay 6 had spent 4 years as a Special Operations Combat Medic attached to an Army SOCOM unit conducting missions in locations that still did not appear on unclassified maps. He did not know about the commendation sitting in a classified file that most people with the appropriate clearance had never been permitted to access. He did not know about the call sign that a small group of operators still used when they talked about her in the way that soldiers talk about people who reached into somewhere dark and pulled them back, not with ceremony, not with volume, but with the particular reverence of people who understood exactly what the alternative had looked like. Caldwell didn't know any of it. That was exactly how she'd designed things to be. The shift had been running quiet for a Wednesday. A compound fracture in Bay 2. A teenager with a dislocated shoulder in Bay 4 who cried considerably louder than the injury warranted. A chest pain admission parked in the hallway waiting on cardiology to return a call that had been placed 40 minutes ago. Lauren had triaged 11 patients in 4 hours, started 2 IVs on difficult sticks that 2 other nurses had already attempted, and talked a 17-year-old through a panic attack in the waiting room, using a voice, So even and unhurried that the girl's mother had grabbed Lauren's arm afterward and said something that Lauren had deflected with a small nod and walked away from, because receiving gratitude was something she'd never gotten comfortable with. She'd eaten half a granola bar at 8:15, standing next to the supply closet with her back to the corridor so nobody would try to hand her something while she was eating. Around 9, she was at a charting station when she heard Caldwell's voice behind her. Mercer. She turned. He was standing with a tablet in his hand, eyes on the screen. He had a habit of addressing staff while looking at something else. Not distraction, she'd decided, but a choice. A way of signaling that the conversation mattered less than whatever he was reading. I'm moving you to Overflow for the rest of the shift. They're short. Overflow is all low acuity right now, she said. We've got 2 pending labs on the chest pain in the hall and a possible pulmonary embolism in Bay. I didn't ask for your assessment. He still hadn't looked at her. Overflow. You've got 30 minutes to hand off. She didn't argue. She turned back to her chart, finished the note she'd been writing, completing it properly, every field, because an incomplete chart was a problem for whoever picked it up next, and then found the charge nurse and handed off her patients with the kind of verbal summary that covered everything the next person needed to know. This was the thing about Caldwell that she had taken a long time to categorize correctly. He didn't dislike Lauren Mercer in particular. She wasn't sure he had the bandwidth for particular dislikes. What he had was a general system, a way of managing nurses who showed any sign of having clinical opinions that hadn't been solicited. The mechanism was simple. Reassign them to lower acuity areas. Reduce their access to interesting cases. Find administrative reasons to keep them out of rooms where thinking was required. It wasn't vindictive. It was just steady, and it worked on most people, who either shrunk themselves down to fit the shape of what was available or eventually transferred out. Lauren had been receiving this treatment for 14 months and absorbing it without visible reaction. Caldwell probably read that as compliance. It wasn't. It was something she'd learned to do in circumstances that made this hospital look uncomplicated. She had learned to be invisible, not as a coping mechanism, as a skill, as a tool she had picked up in places where being seen at the wrong moment had consequences that had nothing to do with getting moved to Overflow. So, in Overflow, she settled in beside a nurse named Petra Olson, who was 43 and had the specific energy of someone who had been in conflict with institutional bureaucracy for long enough that the conflict had become comfortable. Petra handed her a stack of charts without preamble. GI Bleed in 7 has opinions about his care and isn't shy about sharing them, Petra said. Psych Hold in 9 needs vitals every 30 minutes. Guy in 11 is rating his knee pain at a 9, but he walked in without limping, so... Got it. Also, Petra paused, and Lauren noticed the pause. Caldwell left a note that you're not to perform any procedures tonight. Monitoring and documentation only. Lauren looked up. He specified that. Petra held her gaze for a moment. Something moved between them. Not sympathy exactly, more like recognition. The recognition of one person who has been managed in this particular way by this particular institution, and another who is currently being managed in the same way. I'm just passing along what I was told. Understood, Lauren said, and looked back at the charts. She worked through the first hour and a half in Overflow with the kind of focused, quiet competence that didn't announce itself. The GI Bleed patient, a man in his 60s named Walt, who was genuinely uncomfortable and also genuinely difficult, responded better to her than he had to the 2 previous nurses, not because she did anything special, but because she listened to the actual complaint underneath the difficult behavior and addressed that instead. The psych hold was a young man in his mid-20s who was testing the edges of every boundary available to him, and she held those edges without escalating and without being cold, which was a harder balance than it sounded. The man in 11, when she spent 4 minutes actually talking to him instead of about him, admitted his knee was a 4 and accepted ibuprofen with something close to dignity. It was 11:47 when the alert tone came from the charge desk, not the standard ambulance notification. The other one. Lauren heard it from the hallway and felt a particular shift happen in her chest. Not quite alertness, because she was already alert, but something more specific. The recalibration that happens when a sound tells your nervous system something your conscious mind hasn't caught up to yet. That tone was for federal or military notifications. or for the kind of incoming patient that required hospital administration to be contacted regardless of the hour. She had heard it once before in 14 months, and that had been a false alarm, a miskeyed code that had sent two administrators running from their offices for nothing. She walked to the edge of the overflow area and looked down the main corridor toward the ambulance bay. Through the glass, she could see three black SUVs parked at angles that suggested their drivers had been focused on speed over precision. Government plates. The vehicles were still running. She could see the exhaust in the cold night air, and the doors on two of them were standing open, the way doors stand when the people who were inside them left in a hurry and the doors weren't the priority. Men in tactical gear moved around the vehicles with the specific, purposeful efficiency that civilian emergency responders never quite managed to replicate. Not panic, not adrenaline for its own sake. The rehearsed economy of people who had run this particular scenario in conditions that didn't permit mistakes, whose bodies had internalized the sequence to the point where thinking about it would only slow them down. Between two of them, on a stretcher, was a man. Even from the distance of the hallway, even through two panes of glass, Lauren could see the color of him. He was gray, not pale, not the white of shock or the yellow of compromised liver function. Gray, the specific shade that meant perfusion had begun to fail systemically, that blood was not reaching the places it needed to reach, that somewhere in his chest the body had run into a problem it was losing the ability to compensate for. She had seen that color before. She knew what it meant. She knew what it meant, not the way you know something from a textbook, not even the way you know something from clinical experience in a controlled environment, sir, but the way you know something you've seen in the dark with your hands covered in blood, and nothing between the knowing and the doing but the decision to act. She watched the men carry the stretcher through the ambulance bay doors and felt her own hands close slightly at her sides, a reflex she didn't bother trying to suppress. She turned away from the glass. She went back to her patient in Bay 7 because going toward the main ER trauma bay was not what she had been assigned to do, and she was not authorized for procedures tonight, and Caldwell was in there, and the careful structure of her life here, the specific shape of invisible she had worked 14 months to become, depended on not walking toward things that would make her visible. She lasted 4 minutes. The sound from the main trauma bay was what broke her. Not loud. That was the thing. When a trauma team is functioning correctly, there's a particular controlled noise to it, coordinated, rhythmic, people calling numbers and equipment sounds, and the sense of a system moving in sequence toward a defined outcome. What she heard instead was the fractured sound of a team that had lost its sequence. Voices overlapping wrong. A pause in the monitor alarm response that was 3 seconds too long. The specific auditory signature of people who had been handed a situation outside their training and were managing it with the tools they had, which were not quite the right tools. 3 seconds of wrong sound. She walked to the trauma bay door and looked through the wire-reinforced window. Caldwell was at the head of the table. 2 residents flanked him. 3 nurses she recognized were moving around the perimeter. The operators who had arrived with the patient, 5 of them, had positioned themselves against the walls, trying to be out of the way, and not quite managing it because the room was not built to hold 5 large men who couldn't make themselves stop watching. On this table, the man was crashing. She could see it without the chart, without the labs, without the imaging that Caldwell appeared to be ordering based on the way he was directing one of the residents toward the phone. She could see it the way she'd learned to see it, in the distended neck veins visible even from outside the room, in the monitor numbers that showed 74/40, and were not holding there but moving, in the absence of breath sounds on the left, that she could infer from the way the man's chest was moving asymmetrically with each mechanical breath. Tension pneumothorax. Air trapped in the chest cavity, building pressure, compressing the heart and great vessels. Not survivable with a CT scan delay. Not survivable with the protocol Caldwell was working through, which was a reasonable protocol for a patient who had more time than this one had. She pushed the door open. "He has a tension pneumo." The room turned. Caldwell turned. His face moved through surprise so fast she almost missed it before it settled into the expression she knew. The specific controlled irritation of a man whose authority had been walked into without an invitation. "Mercer, you're in overflow." His trachea is deviated. Breath sounds on the left are absent. His pressure is 74 and moving down, and his neck veins are... I can evaluate my own patient. The flatness in his voice was practiced. Go back to Overflow. You have approximately 3 minutes before he arrests. I have an ER director position and you have a temp contract. He held her gaze. Go. Back. She was aware of the room, the residents watching, the nurses who had gone still in the particular way that people go still when they understand that what is happening in front of them has consequences for everyone in it. The operators against the wall who had stopped being tactfully inattentive and were now simply watching. She was also aware of the monitor. 68/38. If you're not going to decompress him, she said, keeping her voice level, then hand me a 14 gauge and step back and I will. You are not authorized. I know I'm not authorized. I'm asking you to do it. Pick up the needle. Find the landmark. Second intercostal space, mid-clavicular line. You know this. Do it right now and I'll walk out of here and we never have this conversation. Something crossed his face. She had expected anger. What she got instead was something that looked uncomfortably like uncertainty. And that was worse because uncertainty was not what the man on the table needed from the person in charge of his care right now. "Now get her out of the bay," Caldwell said. An orderly moved toward her from the left. "Nobody moves her." The voice came from the doorway behind her. Not raised, not commanding in the way that commands get performed for an audience. Just a voice with weight in it. The weight of someone who had spent enough years being listened to that the expectation of it had become structural, invisible, built into the way he used the air. Everyone turned. The man in the doorway was in civilian clothes, dark jacket, open collar, no insignia. He was in his late 50s, with the kind of face that had been weathered into something more precise than it had probably started as. He wasn't physically imposing. He didn't need to be. He walked into the room the way certain people walk into rooms, which is to say, he walked in and the room reorganized itself around him without anyone deciding to let that happen. The orderly stopped moving. Caldwell said, "I'm the director of this emergency department, and whatever you think authorizes you to, Rear Admiral Dale Voss, United States Navy." Quiet, even. "The man on your table is Senior Chief Marcus Tate. He belongs to a unit under my command." He moved to the side of the stretcher and looked at the monitor for a moment with no visible reaction. Then he looked at Lauren. "You said tension pneumo." "Yes." "How confident?" Not quite a question. A test, but not a hostile one. The kind of question that isn't really asking for the information, but for the quality of the person delivering it. "Fully confident," she said. "What do you need?" She was already at the supply cart. 14 gauge needle, second intercostal space, mid-clavicular line, gloves. "Do it." Caldwell said something. She heard the words as sound without processing them as meaning, because she had already gone to the place she went when the work was this specific and this time-sensitive. Not a dissociation, not a dramatic narrowing of consciousness, but the clean functional focus of someone whose body had been trained to do this thing and was now doing it. She had been here before. The room was different, the equipment was better, the lighting was adequate, and the floor was not dirt and nobody was shooting at anyone. None of that changed the essential geometry of the moment. She snapped the gloves, found the landmark on his chest by touch. Second rib, mid-clavicular, the intercostal space just below. The man's chest was moving shallowly. His color, up close, was worse than it had looked through the glass. She held the needle. She felt the resistance of the chest wall. She had felt this before. She knew the resistance and she knew what was on the other side of it, and she pushed through it cleanly, in a single controlled motion, no hesitation, and no drama. The hiss was immediate. Air releasing, pressure that had been building to a point of cardiovascular collapse, escaping now through the pathway she had made for it. The monitor changed, 72/41, then 85/54. Resident Park made a sound. Not a word, just a sound. The involuntary audio of watching something work that you weren't certain was going to work. One of the operators exhaled. Just one breath, audible in the room. 96/60. The deviation in the trachea was already visibly correcting. The neck veins were softening. The monitor was no longer screaming, but had settled into the steady, urgent, but stable tone of a patient in serious condition, rather than a patient in the immediate process of dying. Lauren stepped back from the table. Her hands were steady. They were always steady. She'd stopped thinking about that years ago. It wasn't composure. It wasn't talent. It was just the way her hands were, the way they'd always been under this kind of pressure. And she'd made peace with it not being a virtue a long time back. The room was very quiet. Caldwell was looking at her with an expression she had not seen on his face in 14 months. Not the managed irritation, not the professional condescension, something more complicated and considerably less comfortable than either. Admiral Voss was also looking at her. "Who are you?" he said. The question arrived the way she'd known it would arrive eventually. She had known for 3 years, in the abstract, that this moment existed somewhere in her future. The moment when the thing she was hiding ran into the thing she was unable to stop doing, and the collision produced a reckoning she had no more room to postpone. "Lauren Mercer," she said. "I'm a nurse." "That's not what I asked you." He said it quietly, and he was watching her with an expression that was not suspicious and not hostile, just that quality of recognition pressing toward the surface, like something his memory had filed under a name he couldn't quite retrieve. "I think," he said, low enough that it didn't carry to the rest of the room, "that we should talk." She did not run. Running would have been the operationally intelligent choice, and she knew it, and she did not do it. She stayed in the trauma bay while the team worked to fully stabilize Marcus Tate and prepare him for the surgical consult that would determine what else needed to happen before morning. She charted what she had done in clean clinical language, the clinical reasoning, the intervention, the immediate patient response, because the chart was a legal document and she had done nothing she wasn't prepared to defend, regardless of what Caldwell said about authorization. She answered the surgical resident's questions about Tate's current hemodynamics with the same quiet precision she brought to everything in this building. Caldwell left the trauma bay at some point without speaking to her. She registered his departure the way she registered most things in her peripheral environment. Noted, filed, not given more weight than it warranted. One of the operators had positioned himself in the corner nearest to where she was charting. He wasn't watching her overtly. He was doing the thing people do when they're trying to watch someone without being noticed watching them, which works better on people who aren't trained to notice it. He was young, early 30s, with a bruise along his jawline that was fresh enough to still be spreading. She didn't look at him directly, and she didn't acknowledge that she'd noticed him, because acknowledging it would have required explaining how she'd noticed it. She finished the chart. She logged out of the station. "Tell the Admiral I'll be in the consultation room at the end of the hall," she said to no one in particular, meaning whoever was paying enough attention to relay it. She walked out. In the hallway she stopped, pressed her back against the wall beside a biohazard disposal unit, and breathed. Not to calm down. She wasn't not calm, but because it was the first moment in the past 20 minutes that hadn't had a task inside it, and she allowed herself that much. One breath. Two. Her name was not Lauren Mercer. Her name was Nora Vance, and she had been Nora Vance for the first 29 years of her life. And for 4 of those years she had been Specialist Vance, then Sergeant Vance, and then for the last 18 months of her service, she had been something that was not a name, but a designation. A 2-syllable call sign used in the language of people who operated in the spaces between official records, in places that official records did not acknowledge. She had left it behind. All of it. As cleanly as she could manage. She had built Lauren Mercer from the outside in, real nursing credentials earned over 2 years of school and clinicals in a city where she didn't know anyone, living in a studio apartment and eating cheap food and constructing the visible architecture of an ordinary life. Because the ordinary life was the only protection she had left, and she had needed that protection in ways she wasn't going to explain to anyone. She pushed off the wall. She walked toward the consultation room at the end of the hall. The question wasn't whether Admiral Voss was going to find out who she was. He already knew, or he was close enough that the difference was technical. She could see it in the way he'd looked at her. Not the way people look at strangers, but the way they look at something they've seen before in a different context, in different light, under different circumstances, that their brain is working to reconcile with what's in front of them now. The question was what happened after he confirmed it. And underneath that question, quieter and older, was another one she hadn't let herself look at directly in a long time. The question of whether she had spent the past 3 years constructing a life around the wrong premise. Whether what she had called self-preservation was just another word for something she wasn't ready to name. She pushed open the consultation room door, sat down in one of the gray upholstered chairs, folded her hands on the table. Down the hall, past 2 sets of double doors, in a trauma bay that had been a disaster site 40 minutes ago, A man was breathing on his own. She waited. The door opened. Admiral Voss walked in alone, which told her something. He sat across from her, and for a moment neither of them said anything, and she let the silence run because she had learned in her previous life that the person who breaks a silence first is usually the person who has already decided something. He looked at her for a long moment. Then he set a phone on the table, face down, and said nothing. Then, the call sign was Wren. Her hands folded on the table, did not move. "I think you have me confused with someone else," she said. "Fort Marek, 2019. A JTAC team took casualties during exfil. The combat medic attached to that unit kept 2 of them alive for 4 hours in the field without resupply, under active contact, until the rescue package arrived." He paused. "One of those men is currently serving on the same team as Marcus Tate. He described the medic to me. I've been looking at you since I walked into that trauma bay." She said nothing. Outside, down the hall, she could hear the faint rhythm of the hospital continuing to be a hospital. A PA announcement, a cart moving, someone's radio at the nursing station. "You buried yourself pretty well," Voss said. It wasn't a compliment, and it wasn't a criticism, just an observation. "The paperwork is clean. Someone helped you." "I don't know what you're talking about." "You don't have to confirm anything tonight." He picked up the phone. "But I think you already know that the thing you just did in that trauma bay isn't something most nurses can do. And I think you've known for a while that the life you've been living in this building isn't actually where someone like you ends up." He stood. "We'll talk in the morning." He moved toward the door. Then he stopped. "Marcus Tate has a daughter," he said. "She's 7. Her name is Lily." He was 3 minutes from not going home to her. He looked back at her. "Whatever you're running from, whatever the reason for all of this." He gestured vaguely at the room, at the building, at everything she had built. "You should think about whether it's worth more than what you just demonstrated you're capable of." He walked out. Lauren, Nora, sat in the gray chair in the consultation room and did not move for a long time. Down the corridor, someone was paging a surgeon. On the other side of the wall, the hospital kept running, and the careful, quiet, invisible life she had spent 3 years constructing was already coming apart at every seam, and there was nothing left to do about that now except decide what came next. She sat in that consultation room for 11 more minutes. She knew because she watched the clock on the wall. The old institutional kind with a second hand that moved in discrete jumps rather than a continuous sweep, each jump audible in the quiet room. She sat and watched it and let herself think, which was something she had trained herself not to do in excess because thinking, in her experience, was most useful when it was pointed at a problem and least useful when it was pointed at yourself. The problem was this. Admiral Voss knew, or knew enough that the distinction was academic. By morning, if he didn't already have her full file, he would. The file that didn't exist in any civilian database, that required specific clearances and specific request channels to access, that she had been assured 3 years ago was sealed tight enough that a routine background check would return nothing unusual. That assurance had come from a man she trusted, which meant it was probably still mostly true. Mostly was doing a lot of work in that sentence. She stood up, straightened her scrubs, and went back to finish her shift. This was the other thing she had learned, in her previous life and in the one she'd built since, the value of continuing to do the ordinary thing while the extraordinary thing sorted itself out. Panic was for people who hadn't yet learned that panic was a cost with no corresponding benefit. She walked back to Overflow, checked on her patients, updated her charts, and did not think about Admiral Voss or Marcus Tate or the name she hadn't answered to in 3 years. Petra looked at her when she returned. "Everything okay?" "Fine," Lauren said. "Walt's drainage output?" Petra studied her for half a second longer than the question warranted. Then she handed over the chart. "Slowing down. He might actually behave himself the rest of the shift." "Don't count on it," Lauren said, and went to check. Walt, as it turned out, had decided to cooperate, which made him the only uncomplicated thing about the next 3 hours. At 6:40 in the morning, she clocked out, changed in the locker room, and walked to her car in the staff parking structure. The Pacific Northwest morning was doing its usual thing, gray and soft-edged, the kind of light that made everything look slightly provisional, like the world was still deciding whether to commit to the day. She sat in the driver's seat for a moment without starting the engine. She lived 12 minutes from the hospital, in a two-bedroom apartment that she'd chosen because the lease didn't require a cosigner and the parking was included. She had furniture that was functional and personal effects that were minimal, and a kitchen that she cooked in more than most people expected based on the exterior presentation of her life. She had a neighbor named Frank, who was 71 and fed the birds on his balcony every morning at 7, and had once knocked on her door to borrow a Phillips head screwdriver and stayed for 40 minutes talking about his late wife. She had a route she ran 3 mornings a week, the same route, calibrated to a pace that kept her cardiovascular capacity where she needed it without drawing attention. She had, in short, a life that was designed to look like the kind of life that a person who had nothing to hide would live. She started the car and drove home. She didn't sleep. She made coffee, stood at the kitchen window watching the bird feeder on Frank's balcony accumulate its morning crowd, and thought about Fort Marek. She didn't do that often. Think about Fort Marek specifically. She thought about the work in general sometimes, the texture of it, the way time moved differently in those conditions, the things she'd learned about herself that she would not have learned any other way. But Fort Marek specifically was a place she'd filed somewhere that took effort to access, because the effort was a checkpoint. If it was easy to access, you'd go there too often, and going there too often was a thing she'd watched do damage to people she respected. 2 men from a JTAC team, 4 hours, no resupply, under fire. One of them had a femoral bleed, the other had a sucking chest wound and a broken orbital bone and was trying to die from the head injury while she kept hauling him back. She'd used her own belt as a tourniquet for the first one. She'd used the chest seal from his own kit for the second. And when that failed, she'd used her hand, literally, her hand flat against the wound, for 47 minutes while she waited for the sound of rotors. She'd saved both of them. She'd never known their names. That wasn't how the work operated. You knew call signs, you knew the mission parameters, you knew the specific human being in front of you with absolute clarity for the duration of the crisis. And then the crisis ended and they were extracted and you were extracted separately, and the specific humans became part of the general record of the work. One of them was on Marcus Tate's team. She drank her coffee. At 9:15, her phone rang. She looked at the number. Unfamiliar, but the area code was local. She considered not answering. She answered. Ms. Mercer, Caldwell's voice, which meant he was using his administrative phone, which meant this was an administrative call, which meant something had been set in motion. Dr. Caldwell, I need you to come in. There's a meeting at 11 with hospital administration. Your presence is required. I'm off shift. I understand that. A pause. This is not optional. She looked at the bird feeder. Frank had appeared on his balcony in his robe, shaking seeds into the feeder tray with the unhurried ritual of someone for whom this was the most important part of the day. I'll be there, she said. She arrived at 10:50. She had slept for exactly 90 minutes, not by design but because her body had made the decision independent of her intentions, the way bodies do when they've been running on professional adrenaline for too long and they find a seam. She'd woken up with her phone in her hand and 14 minutes to get ready, and she'd done it in 12. The administrative wing of Mercy Crest was a different architecture than the clinical spaces, carpeted, quieter, with the slightly artificial quality of rooms designed to have difficult conversations in surroundings neutral enough that the difficulty couldn't attach itself to anything specific. The conference room held a long table. Around it, Caldwell, sitting stiffly in a chair that was too comfortable for the way he was sitting in it. A woman Lauren recognized as the hospital's chief operating officer, Diane Marsh, mid-50s, the kind of precise professionalism that could read as warmth or as its exact opposite, depending on which side of a decision you were on. A man from legal whose name Lauren didn't know. And at the far end of the table, Admiral Voss. Lauren sat down without being directed to a specific chair. Marsh opened. Miss Mercer, thank you for coming in. I want to be transparent about the purpose of this meeting. She had a tablet in front of her and she wasn't looking at it. That was either a good sign or a very bad one. Last night's incident in Trauma Bay 1 involves several issues that the hospital needs to address. The clinical outcome for the patient was positive. The manner in which that outcome was achieved raises questions about scope of practice, chain of command, and the specific circumstances that led to, she saved his life, Voss said. Marsh looked at him. Admiral, I appreciate that. And the hospital is, she performed a needle decompression on a deteriorating tension pneumothorax. while the attending physician was ordering imaging on a patient who had, at most, 3 minutes before cardiac arrest. The clinical outcome was not incidental to the manner. The manner was why there was an outcome. Caldwell's jaw moved. The intervention was unauthorized. She is a temporary staff member operating outside her designated. You told her to go back to Overflow, Voss said. He said it without heat, which made it worse. While your patient's blood pressure was 68/34. The room was quiet. Lauren watched Caldwell. Something was happening in his face that she had not seen before. Not the managed authority, not the performed irritation. Something that looked like a man recalculating something he'd thought was already calculated. Ms. Mercer, Mark said, redirecting. The hospital's position isn't that the clinical intervention was wrong. We'll let the review process speak to that. What we need to address is the circumstance of your employment more broadly. She glanced briefly at Voss. Admiral Voss has indicated that he has information relevant to your background that the hospital was not aware of when you were hired. Lauren looked at Voss. He met her eyes and said nothing. Not yet. I was hired through a staffing agency, Lauren said. My credentials are current. My nursing license is valid. I've worked here for 14 months without incident. Without incident, Caldwell said, and the edge in it was barely controlled. You walked into my trauma bay and performed a procedure on a critically ill patient without authorization. And he's alive, she said. She didn't raise her voice. She didn't need to. That's not the... It is the point. She turned to look at him fully, which she'd made a deliberate practice of not doing in this building for 14 months. It is exactly the point. You can dress it in scope of practice and chain of command, and whatever administrative framework makes it feel like a process question, but there is a man who is alive this morning because someone in that room did what needed to be done, and there was someone in that room who was trying to prevent it. She held his gaze. I'm not interested in pretending those two facts don't exist in the same sentence. Caldwell looked at Marsh. Marsh looked at her tablet. The legal man had been writing something and had stopped writing. Voss had the expression of someone watching something he'd expected to happen and was quietly noting that it was happening on schedule. Ms. Mercer, Marsh said after a moment, given the circumstances and the information the Admiral has provided, the hospital is conducting an administrative review of last night's incident. Pending that review, your assignment here is suspended. Lauren looked at her. Suspended. With pay. The review will... How long? We anticipate. How long, Ms. Marsh? A pause. 48 to 72 hours. Lauren nodded once. She picked up the bag she'd set beside her chair, stood, and looked around the table. At the legal man who was avoiding her eyes. At Caldwell, who was not. At Marsh, who was watching her with an expression that was professionally neutral, and behind it something that Lauren chose to interpret as discomfort, because discomfort meant the woman had a conscience that was currently being inconvenienced. At Voss, who looked back at her steadily. She walked out of the conference room. In the elevator, she pressed the button for the lobby and stood with her back against the rear wall and thought about what had just happened with the particular clarity that came from not being surprised. She had known, or had been willing to consider, that this was a possible shape the morning could take. Suspension was the administrative move that protected the institution from both sides, from Caldwell's anger and from the military's scrutiny, while the review process generated enough documentation to justify whatever decision had already been made. The decision had probably already been made. She walked through the lobby and out the main entrance into the gray morning and was 3 steps toward the parking structure when she heard footsteps behind her, measured and unhurried, and she didn't turn because she already knew. Wait, Voss said. She stopped, turned. He looked the same as he had at 11:47 the previous night and in the conference room 20 minutes ago, composed in a way that wasn't performed, settled in a way that meant he wasn't worried about how he appeared because he'd stopped caring about that sometime a long time back. Walk with me, he said. I don't really have anywhere to be right now, she said, which came out with a dryness she hadn't intended, and he caught it, something shifting briefly in his expression that might have been the beginning of a smile. They walked to a bench near the hospital entrance, the kind of institutional outdoor seating that nobody ever sat on by choice, and he sat, and she sat beside him. And for a moment there was just the morning, the ambient sound of the hospital at its front face, a car pulling out of the parking structure, a food delivery truck idling at the service entrance. Marcus Tate is out of surgery, he said. He's in recovery. The surgeon says the prognosis is good. She nodded. You want to know how I found the file? I know how you found the file. I want to know who cleared you to access it. There are 3 people who can authorize access to that record. One of them owed me a conversation. He said it without elaboration, in the tone of someone who understood that the details were not what the other person was actually asking about. Your cover was solid. It should have been solid. The problem is that what you did last night is not something that a nurse with 14 months of ER experience does. It's something that someone with a very specific kind of training does, and one of the men in that trauma bay has seen that training in practice before. In field conditions. In the dark. He paused. He knew your hands. She didn't respond to that. I'm not here to blow your cover, Voss said. If you want to walk away from this conversation and go back to being Lauren Mercer and find another hospital in another city and run that life until... When? Until when exactly? I'd like to know what the end point is. I don't owe you an explanation for my choices. No, you don't. He looked at the parking structure. You also don't owe Marcus Tate's daughter a father, but she has one this morning. She looked at him. That's not fair, she said. No, he agreed. It's not. He reached into his jacket and set a card on the bench between them, face down, and stood. The review is going to conclude in your favor. I'll make sure of that. What Caldwell did last night will be part of the record whether he wants it to be or not. He buttoned his jacket. When you've had time to think, that number reaches me directly. He walked back toward the hospital entrance. She sat on the bench and looked at the card. She didn't pick it up for a full minute. When she did, there was no name on it. Just a number, handwritten, and below it 2 words. When ready. She put it in her pocket. The next 48 hours were the particular misery of having nothing required of you when what you needed was to be occupied. She ran her route each morning, longer than usual, pushing past the calibrated pace she normally maintained into a harder register that left her winded in a way she didn't often let herself get. She cooked things she didn't eat. She sat with a book open in her lap and read the same paragraph 4 times without retaining it. On the second evening, she got a call from Petra. Thought you should know, Petra said. Caldwell's been in meetings all day. Administration, legal, risk management. I don't know what's happening, but the charge nurses are talking, and what they're saying is that it's not small. What are they saying specifically? That there's a review of multiple incidents, not just last night. Apparently someone's been talking to nursing staff about, Petra paused, choosing words, about patterns, in the way certain patients get managed, and in the way certain staff members get handled. Another pause. I think someone asked about you, by name, about your assignments and your scope restrictions and the frequency of your overflow transfers. Lauren was quiet for a moment. Who's doing the review? I don't know. Hospital admin is involved. And I think someone from outside, someone from... I couldn't hear all of it. Petra lowered her voice, even though she was presumably calling from somewhere private. Lauren, there were military people in the building today. Not the guys from the other night. Different people. Suits. Okay. Okay? That's it? What would you like me to say, Petra? A long pause. Are you all right? The question landed in the middle of her chest with more weight than she expected, because Petra had not asked it to be asking something. Petra had asked it because she wanted to know the answer, and Petra was one of approximately 3 people in Harlow Falls who would have noticed the difference. I'm working on it, Lauren said. Good enough? A beat. For what it's worth. What you did in that trauma bay. I know you can't tell me how you knew what you knew, but I've been a nurse for 16 years, and I've worked with a lot of people, and I have never seen someone move through a room like that. She paused. Like it wasn't a decision, like it was just the next thing, the obvious thing. Lauren looked at the window. Frank's balcony was empty. The bird feeder swayed slightly in the evening wind. Get some sleep, she said. You too, Petra said, which they both knew was unlikely for either of them. On the 3rd morning, her phone rang at 7:12, and it was a number she didn't recognize, and she answered it, and the voice that came through was female and efficient and said, Miss Mercer, this is Karen Aldis. I'm the Chief of Staff for Rear Admiral Voss. He'd like to see you this morning, if you're available. 10 o'clock. Harlow Falls Federal Building, room 412. That's not a hospital, Lauren said. No, ma'am, it's not. Why the federal building? A brief pause. The Admiral will explain that when you arrive. She arrived at 9:55 because arriving early to an unknown situation was a habit she'd never broken. The federal building was downtown, the kind of mid-century architecture that communicated permanence without beauty, and room 412 turned out to be a conference room with a window that looked out over the city's modest skyline and a table with 6 chairs around it, only 2 of which were occupied. Voss sat at the far end. Beside him, in civilian clothes that were clearly not his natural habitat, was a man she hadn't seen before, late 40s, thick-necked, with the particular way of sitting that meant he was more comfortable in a different kind of chair in a different kind of room. Special operations background, she guessed. Senior NCO or junior officer, retired or recently separated. There was a third person in the room. He was in a hospital bed that had been positioned against the far wall, elevated enough that he could sit partially upright, with monitors on a portable stand beside him and an IV in his left arm, and he was looking at her with dark eyes that were tired and alert, at the same time in the way of someone whose body had been through something serious, but whose mind was running ahead of it. Marcus Tate. She stopped in the doorway. "Close the door," Voss said. She closed it and walked into the room and stood at the end of the table and looked at Marcus Tate, who looked back at her with an expression she couldn't immediately categorize. "You don't know me," he said. His voice was rougher than she'd expected, probably from the intubation. "I was unconscious. I know. But I know you." He glanced at the thick-necked man beside Voss. "Reardon told me. He was there. Fort Merrick." She looked at the man. Reardon. Younger than she'd registered when he was standing against the wall of the trauma bay with a bruise forming along his jaw. The bruise was more developed now, a full spectrum of purples and yellows. She looked at his face and tried to find the 26-year-old she'd held together in a ditch for 4 hours in the dark. She couldn't find him. He'd become someone else in the intervening years. She probably had too. "I don't have anything to confirm about that," she said. "You don't have to." Reardon's voice was even. "I'm not asking you to confirm anything. I'm just telling you that I know who saved my life at Fort Merrick, and I know who saved his life 4 nights ago." He nodded toward Tate. "And those 2 people are the same person. That's all I've got to say about it." The room held that for a moment. "Sit down," Voss said. She sat. Voss folded his hands on the table. "The hospital review concluded this morning. The finding is that the clinical intervention you performed was appropriate, justified, and within the scope of emergency necessity given the circumstances. Caldwell's decision to order imaging on a patient in active hemodynamic compromise is part of the record. His pattern of restricting nursing staff below their competency level is also part of the record, because it turns out that once someone starts pulling on that thread, it doesn't stop at one incident." "How far does it go?" she asked. "Far enough that it's no longer just a hospital problem. The board met this morning. Caldwell is on administrative leave pending a full review that will take significantly longer than 72 hours. She took that in. She had not let herself think about Caldwell with anything that resembled satisfaction, because satisfaction was a distraction, and also because she was aware of her own capacity to want something that looked like justice, but was actually something more personal and less clean. But she noted it. The board. Administrative leave, the thread being pulled. "Your suspension is lifted," Voss continued. "You can return to your position whenever you choose." "But that's not why I'm here." "No." Tate shifted in the bed. The monitor beside him registered the movement, a small spike, a return to baseline. He was watching her with that same tired, alert quality. "I have a daughter," he said. "I know," she said. "Lily, 7. Something moved across his face. "Voss told me you'd been informed." He was quiet for a moment. "I'm not going to make a speech at you. I know people in my situation tend to do that, and I know it's uncomfortable. So I'm just going to tell you that I understand what you risked, what it cost you for someone to be in that room asking the questions they're asking now. And I wanted to say that directly to you. That's it. That's all I've got." She looked at him. Tate was not what she'd expected, though she hadn't been sure what she'd expected. She'd had limited data, given that when she'd met him he was gray and unconscious and dying. He had the look of someone who'd been around long enough to have stopped performing. He was direct without being aggressive about it. He'd said exactly what he meant and had clearly decided in advance that he was going to, and now he was done. "Thank you," she said. She meant it. Voss cleared his throat. There's something else, and I want to be clear. This is not a condition of the hospital's decision or of anything else. This is a separate conversation that you are under no obligation to have. She looked at him. There's a position, he said, attached to a joint medical training program under SOCOM oversight. The program works with special operations units to develop and maintain high-level trauma capability, not just for medics in the field, but for integrating civilian medical professionals who have the background to bridge both environments. It is not a return to active duty. It is a consultancy. It is structured in a way that accommodates a civilian life. He held her gaze. It also comes with a renegotiated identity situation, something more stable than what you've been working with. The room was quiet. Outside the window, Harlow Falls was being the mid-sized, ordinary city it always was. Traffic on the street below, a transit bus pulling away from a stop, two pigeons on the window ledge of the building across the street doing whatever pigeons found worth doing at 10 in the morning. She thought about the consultation room in Mercy Crest, the gray chairs, the institutional clock, the 11 minutes she'd sat there deciding whether to stay or run. She thought about Petra saying like it wasn't a decision, like it was just the next thing. She thought about the 4 hours at Fort Marek and the 90 seconds in Trauma Bay 1, and the common thread running through both of them, which was not training and not skill, but something more stubborn than either. The inability to be in a room with someone dying and be the person who decided that someone else's authority mattered more than the dying. She had built a life around being invisible. She was sitting in a federal building with a Navy admiral and a senior operator, and the man she'd saved, and none of them were looking at her like she was invisible. And she was not sure, in this moment, that invisible was still what she wanted to be. I need time to think, she said. Of course, Voss said. I also need to know... She stopped, started again. The stability of the new arrangement. If I step out of the current structure, how solid is it? Solid enough that what happened this week doesn't happen again. She looked at him. That's a significant promise, she said. Yes, he agreed. It is. She stood, picked up her bag, looked at Tate one more time. The man who was alive because she had been standing in the wrong part of the building at exactly the right moment, or the right part of the building at a moment that had been inevitable regardless of where she'd started. Tell Lily her dad is going to be okay, she said. Tate looked at her for a moment, and something in his face did something complicated and brief and then resolved. She already knows, he said. I told her this morning. Lauren nodded. She turned toward the door. She had her hand on the handle when her phone buzzed in her pocket. She almost didn't look. She looked. It was a text from a number she didn't recognize, and the text was 4 words, and those 4 words were enough to stop her hand on the door handle and hold her there in the space between staying and leaving while the federal building hummed its neutral hum around her. And in the bed behind her, Marcus Tate's monitor kept its steady rhythm. 4 words. We know where you are. She stood at the door of room 412 with her hand on the handle and her phone in her other hand, and let herself have exactly 3 seconds of the particular cold that comes not from fear, but from the recognition that a situation you thought was contained has edges you didn't map correctly. Then she turned around. We have a problem, she said. Voss was already reading her face. He'd been reading people in rooms for 30 years, and he didn't need her to explain the transition from the woman who'd been about to leave to the woman standing in the middle of the room, holding a phone like it was evidence. Show me, he said. She crossed to the table and set the phone down in front of him. He looked at it. Reardon leaned in from his left. Tate, from the bed, couldn't see the screen, but he could read the room, and she watched him push himself more upright, ignoring the pull of the IV line. Unknown number, Voss said. Burner, or routed through something. You won't trace it in any useful time frame. When did you get it? 40 seconds ago. Voss looked at Reardon. Something passed between them that was mostly eyebrows and a slight adjustment of posture. The compressed communication of people who had worked together long enough that full sentences were optional. How many people knew you were coming here this morning? Reardon asked her. Nobody. I didn't tell anyone. The building has a public lobby, Tate said from the bed. His voice was steady despite the monitors and the IV and the fact that he was a man who had been in surgery 72 hours ago. If someone already had eyes on her, they wouldn't need to know her schedule. They just need to follow her. I wasn't followed, Lauren said. Reardon looked at her. I wasn't, she said, with enough flatness that he let it go, because the flatness was not defensiveness, but the tone of someone stating a fact about a thing they know how to evaluate. Then they knew about the meeting, Voss said, which means either the meeting was intercepted, or someone on a very short list of people with knowledge of this room talked to someone who shouldn't have that information. He picked up his own phone. I need to make 2 calls. Neither of you move. He stepped to the window. Lauren sat down. Not because she needed to sit, but because standing in the middle of the room, waiting for information, was a waste of energy. She put her phone on the table face up and watched it the way you watch something you don't expect to move but need to be looking at if it does. Tate was watching her. You're not panicking, he said. No. Most people would be. Most people haven't had a lot of practice with the alternative. She glanced at him. How's the pain? He blinked. The shift in register caught him off guard. She could see it. Managed, he said. They have you on what, oxycodone? And something else, I don't remember what they called it. Ask them to check the dosage schedule before your next surgical review. Post-op inflammation peaks around 72 hours, and they sometimes underadjust. He stared at her for a moment. You just received a threat, and you're giving me medication advice. You needed the advice. The threat isn't going anywhere in the next 30 seconds. She looked back at her phone. And focusing on something useful keeps the adrenaline from becoming noise. Tate was quiet for a moment. Then, Reardon said you kept talking to him, the whole 4 hours at Fort Marek. Even when he was going in and out, you just kept talking. It helps, she said. People do better when there's a voice. What did you talk about? She thought about it. Mostly I made things up. I told him about a road trip I'd never taken. He told me about his sister's dog. She paused. He was very specific about the dog. From the window, Reardon made a sound that was not quite a laugh, but was adjacent to one. Voss came back to the table. The building's security log shows a civilian vehicle in the parking structure that ran the plate system for floor 412 access 20 minutes before your arrival. The plate is registered to a rental agency. The rental was paid cash, which the agency is not supposed to allow, and did anyway, and the ID used was... He stopped. Insufficient, let's say. Someone was already here, Lauren said. Someone was already here, he confirmed, which means the text isn't a warning. It's a demonstration. They wanted you to know you'd been seen. To pressure me. To pressure you away from this conversation, or toward a different one. She thought about that. Someone knew about the meeting. Someone knew about me before the meeting. That's not a small operation. No, Voss said. It's not. He sat down. Before I tell you what I think is happening, I need to know something. In the 3 years you've been running as Lauren Mercer, did you have any contact with anyone from your previous life? Any communication, however brief, that could have generated a thread someone might follow? She looked at the table. She thought carefully, because this was not a question to answer carelessly. Once, she said. Voss waited. 14 months ago, before I came to Mercy Crest, I ran into someone in Portland, someone I'd worked with. It was accidental. A grocery store, of all things. We didn't speak. I left. She paused. But he saw me. Name. Warrant Officer Dale Pruitt. He was attached to a logistics unit out of Pendleton. We overlapped for about 8 months during my second deployment. Reardon and Voss exchanged another look. This one had more information in it. Pruitt, Reardon said. Flat, just the name. But the way he said it meant something. Tell me, Lauren said. This. What Reardon told her took 11 minutes and rearranged several things she thought she understood. Dale Pruitt had separated from service 20 months ago under circumstances that the official record described as voluntary, and that the unofficial record, in the way unofficial records worked in these environments, described differently. He had been attached to a procurement and logistics operation that had been under quiet internal scrutiny for 14 months before his separation. The scrutiny had not produced a formal investigation, not yet, because the kind of quiet internal scrutiny that happened in the spaces between official oversight moved slowly and required patience that institutional processes didn't always have. What the scrutiny had found, slowly, was a pattern of medical supply diversion. Equipment and pharmaceutical inventory allocated to forward operating units, the kind of units that operated in the spaces between official maps, being documented as delivered and not arriving. Battlefield-grade supplies. Trauma kits. Specific medications that had specific applications in specific kinds of operations, being documented out of one system and not appearing in another. The diversion had a financial trail that was deliberately obscured and had taken the scrutiny 14 months to partially unravel. Pruitt was not the architect of it. He was, as best as anyone could determine, a knowing participant who had decided at some point that his cooperation with the people running the scheme was a better survival strategy than his cooperation with the people investigating it. "He saw you in Portland," Reardon said, and within 6 weeks the quiet scrutiny started running into interference. Sources went quiet. Documents that had been accessible became inaccessible. Someone who had been cooperating with the investigation stopped cooperating. He looked at her steadily. "We don't know that those things are connected to you, but the timeline is a problem," she said. "Yes." She sat with that for a moment. 14 months ago, a grocery store in Portland. A face she recognized across the produce section, the half-second of eye contact before she turned and left. She had assessed it at the time, threat or no threat, action or no action, and had concluded that a warrant officer with no particular reason to be looking for her and every reason to be minding his own business was not a significant risk. She had been wrong, not catastrophically wrong. She was sitting in this room, which meant she'd stayed ahead of whatever Pruitt had set in motion, but wrong enough that someone with a burner phone and access to the parking system of a federal building had just told her they knew where she was. "What's the connection to Marcus?" she said. Not a question. Voss answered. "The unit Tate's team was operating with 6 weeks ago was drawing from the same supply chain. The operation that put him in that trauma bay, the one that generated the injury you treated, happened in the context of a mission that intersected, indirectly, with the supply diversion network." He paused. Someone knew that mission was happening. The circumstances of Tate's injury were not entirely the result of enemy contact. The room changed temperature slightly. "Someone burned the mission," Reardon said. Quiet. Controlled. The particular control of someone who had been living with that information for a while and had decided what to do with the anger before he opened his mouth about it. "Tate, from the bed. We're not confirmed on that." "We're close enough to confirmed," Reardon said, and Tate didn't argue, which was its own kind of confirmation. Lauren looked at Voss. "And now that I'm in the picture, what does that change for whoever sent this text?" "You're a witness," Voss said. "To Pruitt, in Portland. You can place him in proximity to a timeline that investigators would very much like to document. And you're—" He chose the next words carefully. "You are someone whose background, if it surfaces in the wrong context, becomes a liability for the people who helped you disappear, which gives them leverage they can use to keep you quiet." "They don't know what I know," she said, "about Pruitt, about the timeline. They know you might know something. In this kind of operation, that's sufficient." She thought about the grocery store, the way she'd cataloged it and filed it and moved on, the efficient calculation she'd made and gotten wrong. "What do you need from me?" she said. But what they needed from her was not a small thing. The federal building had a situation room on the second floor. Not dramatic, not the kind of thing that appeared in films, just a windowless room with a large monitor and a conference table and a secure phone line, and the kind of functional austerity that meant everyone in it was there because the work required them and not because anyone had thought about comfort. Voss got Tate moved, against Tate's surgeon's preferences and with a portable monitoring setup that the surgeon described as inadequate, and Tate ignored. And within 40 minutes of the text message, Lauren was sitting at the table in that room with Voss and Reardon and 2 people she hadn't met before. One was a woman in her 40s named Sikowski, who had the specific quality of stillness that Lauren associated with people who gathered information for a living and had learned to present as smaller than they were. The other was a man, younger, who was introduced only by the name Ferris, and who sat with a laptop open and didn't look up when she came in. Sikowski laid it out without ceremony. The supply diversion network had been operating for approximately 26 months. It had siphoned an estimated $4.7 million in equipment and pharmaceutical supplies from forward medical allocation. Some of what was diverted had been sold, some of it had been used. At least 2 of the pharmaceutical diversions had involved medications with specific tactical applications, not the kind of medications that ended up in civilian markets without generating a very specific kind of attention. 3 investigators who had been building the case had experienced interruptions. One had been transferred under circumstances that administrative review had found unremarkable. One had taken medical leave and not returned. One was still working the case but had been operating with dramatically reduced access for the past 8 weeks. "We have the financial architecture," Sikowski said. "We have the movement records. What we don't have is a witness who can place a human connection between the supply chain and the decision-making level. Documents can be explained away. Databases can be contested. A human being who can testify to a face at a specific location at a specific time is considerably harder to discredit." Lauren looked at her. "You want me to give you Pruitt?" "We want you to give us what you saw. When, where, what. We'll handle Pruitt." "I told Voss it was a grocery store. I saw his face. I left. I have nothing beyond that." "You have a precise memory of date, time, and location." "I have that." "And you have credibility." Sikowski looked at her with the direct appraisal of someone who had spent a career assessing what people were worth in very specific operational contexts. "Your background, the real one, is not something that can be easily attacked. What you did in Trauma Bay 1 is documented and reviewed and found unimpeachable. You are not a convenient witness who appeared from nowhere. You are a specific kind of person with a specific kind of record, and that matters in front of a federal judge." Lauren looked at Voss. He met her gaze and said nothing, which meant he'd said what he had to say, and the rest was hers to carry. She looked at the table. She thought about the text message. "We know where you are." She thought about what that meant in practical terms. Not the threat of it. She'd lived around threats before, but the implication that someone had decided she was a variable that needed to be managed. She thought about being a variable. She thought about what the alternative to being a variable was. "If I do this," she said, "the identity situation, resolved," Voss said, "before you walk into any formal setting. And my position at Mercy Crest. That's your decision. You can return, you can transfer, you can do neither. None of that is conditional on this." She thought about Petra. She thought about Walt with his GI bleed and his opinions. She thought about the teenager in Bay 4 who cried too loud for a dislocated shoulder and the mother who'd grabbed her arm. "Walk me through what testifying looks like," she said to Sikowski. "Specifically." They were 40 minutes into the specifics when Ferris, who had not looked up from his laptop since the meeting started, said, "We have a problem." The room gave him its attention. "The vehicle from the parking structure this morning, the rental. It moved." He turned the laptop so the screen faced the room. A map of Harlow Falls, a route traced in red. "It pulled out of the federal building structure at 10:42. It's currently," he zoomed the map, "parked 2 blocks from Mercy Crest Medical Center." The room was quiet for a moment. Then Reardon said, "Why Mercy Crest?" And Lauren knew why. She knew before anyone else in the room reached the same conclusion, because she was thinking about it from the right angle. Not from the angle of what did they want with the hospital, but from the angle of what at the hospital could be used as pressure. "Petra Olson," she said. "She called me last night. She was asking questions about what was happening with the review. If they've been monitoring my phone, we have to assume they've been monitoring your phone," Sikowski said. "Then they know about Petra, and they know she knows something, or they think she does." Lauren was already standing. "She's on shift right now. She starts at 7. She doesn't leave until 3. We can send someone now." Lauren looked at Voss. "Right now. Because if they're at Mercy Crest and they know she talked to me, they're not there to watch." Voss was already on his phone. He said 4 words into it and then looked at Reardon and said 3 more, and Reardon was out of his chair and moving. "I'm going," Lauren said. "That's not... She's there because of me." Not a discussion. Just a fact, stated in the same tone as clinical information, the tone that meant she'd already processed the argument and wasn't going to have it. "I'm going." Voss looked at her for a half-second that had the texture of a much longer argument compressed into the time available. "With Reardon," he said. "Fine." The drive to Mercy Crest took 9 minutes. Riordan drove with the specific economy of someone who had done this in conditions where 9 minutes was an aspiration rather than a result. Lauren sat in the passenger seat and did not talk and did not look at her phone and kept her breathing at the rate she wanted it at. "Do you carry?" Riordan asked. "Not since I left." "There's a Glock 17 in the glove box." She opened it. The weapon was there, with a full magazine beside it. She checked the chamber, loaded it, clicked the safety, and held it in her right hand without comment. "You didn't hesitate," he said. "Should I have?" He didn't answer. She hadn't expected him to. Mercy Crest appeared ahead, the familiar profile of the building, the parking structure, the ambulance bay entrance. Normal looking. Morning shift in full operation, cars in the lot, the usual ambient movement of a hospital that didn't know anything unusual was happening in its vicinity. Riordan pulled to the curb 2 buildings short of the main entrance and stopped. "The rental," he said, and nodded. She saw it. A gray sedan parked in a visitor spot near the main entrance, with the casual placement of a vehicle, parked by someone who didn't intend to be there long. "One vehicle," she said, "didn't intend to be there long." "One vehicle," she said. "Doesn't mean one person." "No." She thought about Petra. Petra who had called last night. Petra who had been a nurse for 16 years and had never once dealt with anything like this, and who would have absolutely no framework for recognizing that the person asking her questions was not someone she should be talking to. Her phone buzzed. She looked at it. Unknown number again, different from the first one. The text said, "Step back," or she gets an unexpected diagnosis. Riordan read it over her shoulder. She heard him exhale, slow, controlled, the kind of breath that meant he was managing something. "They're already inside," she said. "Looks like," she thought. Hospital layout. She knew it the way she knew every layout she worked in, by instinct and repetition. Main entrance was the obvious route, and obvious was wrong. Service entrance on the south side. Loading dock with a code that hadn't been changed in 9 months, because Caldwell had been the one who managed that administrative calendar, and Caldwell was currently suspended. She knew the code. She knew the code. "South service entrance," she said. "I can get us in without going through the lobby." "Walk me through the interior." She did. Quickly, precisely. Service corridor to the central stairwell, 2nd floor to avoid the ER entrance, east wing to the staff workroom where Petra's shift typically staged out of. She gave him the layout in the compressed, efficient format she'd learned to use: landmarks, distances, choke points, alternatives. Riordan listened without interrupting. "Okay," he said. "You're with me the entire time. If I tell you to stop, you stop." "If I tell you to stop, you stop," she said. He looked at her. She held his gaze. "Okay," he said again, with a slightly different weight to it. They moved. The service entrance code worked. The corridor was clear. She'd expected that. The south corridor at this hour was low traffic, maintenance, and dietary, and the specific invisibility of the working infrastructure of a building that presented a different face to its public entrance. They moved through it at a pace that was fast, without being the kind of fast that attracted attention from the 2 orderlies they passed, who registered them with the peripheral awareness of people who were thinking about something else. Stairwell. 2nd floor. The east wing had the quality of a quieter hospital space. Outpatient offices, administrative overflow, 1 small waiting area with 4 chairs and a water dispenser. At the far end of the wing, through a door with a push bar, was the staff workroom. Lauren could hear voices before she got to the door. She put her hand on Riordan's arm and he stopped. 2 voices. One was Petra's. She could identify it by register and cadence even muffled through a door. The other was male and not raised, which was almost worse than raised would have been. The quiet, instructional quality of someone explaining terms. She looked at Riordan. He moved to the left side of the door. She took the right. He held up 3 fingers. 2. 1. He pushed through. The room had a table, a coffee maker, open lockers along the far wall, and 2 chairs. Petra was in one of the chairs, not restrained, but her body had the rigid posture of someone who understood that they were in a situation where any movement was potentially wrong. The man standing across from her was in civilian clothes, with the build of someone who maintained it professionally, and the expression of someone whose plan had just encountered a variable. He started to reach. "Don't," Riordan said, clear and flat, and with no performance in it. The word that means what it says and nothing else. The man stopped. Lauren moved to Petra. You okay? Petra looked at her. Her face had the particular expression of someone who had been frightened and was now managing it with the adrenaline that comes after. Eyes wider than usual, jaw set in compensation. I'm okay, she said. And then, Lauren, what is... In a minute, Lauren said. Can you stand? Yes. Stand up and walk to the door. Keep walking until you're in the main corridor and find someone with a hospital ID and stay with them. Petra stood. She looked at Reardon, at the man against the wall, at Lauren. Lauren, are you... Go, Lauren said. Petra went. Reardon had the man, late 30s, bruising around the knuckles of his right hand that had not been there at any point in the morning's events, which meant it was fresh. Positioned against the wall with the particular geometry of someone who knew how bodies and angles worked in a confined space. Phone, Reardon said. The man said nothing. You sent the text, Lauren said, from 2 different numbers. Still nothing. You're working for someone who told you that a nurse who made a noise in a hospital needed to be managed, she said, and someone told you that managing her meant using her colleague as leverage. She watched his face. You didn't expect Reardon. You expected me to come in alone, or not at all, and you expected to be out of the building before anyone with the right clearances knew you'd been here. She paused. That was a miscalculation. The man's jaw shifted. Not fear. Something more controlled than fear. Recalculation. The people you're working for, she said. They diverted medical supplies from units in the field. They burned a mission that put Marcus Tate in a trauma bay. They've been running interference on a federal investigation for 14 months. She held his gaze. And they sent you to lean on a nurse in a staff break room. She let that sit for a moment. That is not a sign of an operation that is working correctly. Something moved in his face. Brief. A fracture in the controlled surface. We have the financial architecture, she said. It was a partial truth. She was telling him what Sikowski had told her, presenting it as more complete than it was. What we don't have yet is the human connections, the names on the decision-making side. She paused. Whatever they're paying you, they're asking you to be the name that surfaces when the financial architecture gets the human layer attached to it. The man looked at her for a long moment. Reardon's phone buzzed. He glanced at it without moving his position. Voss? 3 minutes out with 2 federal agents. The man heard that. Something in his face made a decision. I want a lawyer, he said. You'll get one, Reardon said. I want one before I say anything to anyone. That's your right, Lauren said. But the federal agents walking into this building in 2.5 minutes are going to want to know whether you're the person who made the decision to burn that mission or the person who was following orders from the person who made the decision. Those are very different positions to be in. She watched him. And the clock on which position is available to you runs out when they walk through that door. The room held it. The man's jaw worked. He said a name. One name, pulled out of the controlled surface with the particular reluctance of someone who had just made a calculation and didn't like the result, but liked the alternative less. Lauren looked at Reardon. Reardon looked at her. The name he had said was not Dale Pruitt. The name he had said was not anyone on the list she had assembled from Sikowski's briefing. The name he had said was a name that she recognized from a different context entirely. A context that reached back not 3 years, not 14 months, but considerably further into the architecture of the operation she'd been attached to during the last year of her service, the year before she'd decided to disappear. The name he had said was someone who should not have been anywhere near this. The name he had said changed the shape of everything she thought she understood about why she had needed to disappear in the first place. Outside, in the corridor, she could hear the sound of the elevator opening. The federal agents were in the building, and in the staff break room of Mercy Crest Medical Center, Lauren Mercer, Nora Vance, stood with a name in her head that she needed Voss to hear immediately, because if the name was accurate, then the supply diversion and the burned mission and the text messages were not the operation, they were the edge of it. She said it out loud to Reardon in the 11 seconds before the federal agents reached the break room door. Not the whole sentence, just the name. 3 syllables spoken at a volume calibrated for his ears only, and she watched the recognition move through his face in the specific way that recognition moves through the face of someone who knows the name and is now rapidly reorganizing everything they thought they understood around the fact that the name belongs in this conversation. "You're sure?" he said. "I'm sure he said it. I'm sure I know who it is. Whether it's accurate is a different question." The door opened. Two agents, a man and a woman, both in the particular civilian clothes that federal agents wore when they were trying not to look federal and succeeding only partially. The man was carrying cuffs. The woman had her hand near her hip, which she moved away from when she assessed the room and determined it was contained. "Agent Solis," the woman said. "This him?" "Yes," Reardon said. "He gave us a name. I need Voss on the phone in the next 60 seconds before anything else happens." Solis looked at Lauren. "Assessment. Rapid. Professional." "You're Mercer." "Yes." "You're coming with us." "I know," Lauren said. The federal building's second floor had acquired additional people in the 43 minutes since she'd left it. Sikowski was still there, now with a second laptop open beside the first and 3 phones on the table arranged in a row, like she was managing parallel conversations, which she probably was. Ferris had moved from the corner to a position directly in front of the large monitor, which was displaying a map she didn't recognize immediately. Not Harlow Falls, something larger, a regional network diagram overlaid on geography. Voss was standing when Lauren walked in. He looked at Reardon first. Reardon said the name. The room changed, not dramatically, not visibly, to someone who didn't know how to read it. But Sikowski's hand stopped moving over the keyboard for exactly 2 seconds, and Ferris turned from the monitor, and Voss's expression did something that was not surprise. He was past surprise, she could see that, but was a very particular recalibration of someone who had suspected a shape and was now being shown that the shape was larger than suspected. "Hartwell," Voss said. Flat. Just confirming the word had been spoken in this room. "Brigadier General Warren Hartwell," Lauren said. "That's the name the man in the break room gave us." "He gave it voluntarily?" "Voluntarily enough?" Sikowski had already turned back to her keyboard. "Hartwell is currently serving as Deputy Director of Logistics and Medical Readiness, Joint Command Level. He has oversight authority over the supply chain allocation system that the diversion was running through." She was reading as she spoke, pulling from something on her screen. "He also has—" She stopped for a half-second. "He has historical connection to 2 of the 3 investigators who experienced interruptions. One was a direct report. One attended the same command program at the same time, 18 years ago. He's not peripheral," Lauren said. "He's the architecture." "If the name checks out," Voss said, "then check it out." She looked at him steadily. "The man in the break room gave it up because he was looking at 2 different futures and chose the one where he wasn't the top name on the list. He has no reason to give a name that doesn't hold up. That's not how that calculation works." Voss looked at Sikowski. "Working on it," Sikowski said, which meant she'd been working on it since the name left Reardon's mouth. Lauren sat down. Her legs were not unsteady. They weren't. But she sat because the next part of this was going to be sitting work rather than moving work, and she understood the difference. She put the Glock on the table in front of her because carrying it in a federal conference room seemed like the wrong message, and Ferris looked at it and looked at her and then looked back at his monitor without comment. She thought about Warren Hartwell. She had met him once. Not known him. Met him. A briefing in the 3rd year of her service. A joint command overview that she'd attended as a medic attached to a forward unit. One of those gatherings where the operational personnel sat in rows and the senior officers stood at the front and spoke about strategic frameworks in language calibrated to sound like information while containing the minimum amount of it required. Hartwell had been a colonel then, not yet a general. She remembered him because he had asked her unit's commander a specific question about forward medical asset deployment. The kind of question that demonstrated precise knowledge of supply chain mechanics. And because the answer her commander had given was wrong, and Hartwell had known it was wrong and had moved on without correcting it, she had filed that at the time as a thing that happened in those gatherings. Senior officers ask questions that aren't really questions. Commanders give answers that aren't really answers. The operational people sit in their rows and count the minutes. She was thinking about that question now with a different frame on it. The precise knowledge of supply chain mechanics. The decision not to correct a wrong answer that would have tightened supply accountability. She had been in the same room as the architecture of this thing and not known what she was looking at. "There's a timing problem," she said. Voss looked at her. "If Hartwell is running this, not just participating, running it, Then the burn mission wasn't about Tate specifically. It was about something Tate's operation was going to find. She worked through it as she spoke, because working through something out loud was sometimes the only way to find where the logic held and where it didn't. What was the objective of the operation that put Tate in the field? Reardon and Voss exchanged a look. That's currently classified, Voss said. I need it unclassified, now. Or I'm working with incomplete information, and so are you. A pause. Voss looked at Reardon again, longer this time. Reardon said, document retrieval, a cache of procurement records from a decommissioned forward operating base. Paper records, not digitized. The kind of records that would have documented what was actually received versus what was logged as received. And Tate's team was going to retrieve them. That was the objective. Did they? A longer pause. Partially. The mission was compromised before full retrieval. Tate's injury happened during exfil with whatever they'd managed to pull. She thought about this. Where are the documents now? With the remainder of Tate's team, secured. Hartwell knows they exist. He knew the operation was happening. He burned it, which means he had access to the mission parameters. He knows the team came out with something. She looked at Voss. He doesn't know how much they got, and he's trying to figure out how much the investigation has. That's what this morning was. Not just pressure on me. Information gathering, finding out how far the investigation has gotten by watching who I talk to and who talks to me. Sikowski looked up from her laptop. If that's right, then the text message was a probe, not a threat. It was both, Lauren said, but you're right that the primary function was diagnostic. Which means, Sikowski said slowly, that if Hartwell is watching the investigation through Lauren's contacts and movements, then we have a channel. The room absorbed that. Ferris turned from the monitor. For the first time since she'd entered the building, he addressed her directly. Could you make contact with someone connected to Hartwell without it reading as unusual? Someone who would logically reach back to him? She thought. Pruitt. Dale Pruitt saw me in Portland. He's already in Hartwell's network as a participant. If he saw me again, if I made sure he saw me, and if Hartwell is watching Pruitt the way he's been watching my movements, then Pruitt's reaction gives Hartwell information. What kind of information? Voss asked. Wrong information. She looked at him. If Pruitt reports back that I'm operating alone, that the conversation in this building was preliminary and inconclusive, that the investigation doesn't have the supply chain documentation yet, Hartwell slows down, stops moving assets, thinks he has time. And while he thinks he has time, Sikowski said, you use the documents Tate's team retrieved. You use my testimony about the timeline. You use the man from the break room, who is currently sitting in a room somewhere in this building deciding how cooperative to be. Lauren looked at Voss. You build the case from 3 directions simultaneously, and you move before he realizes the channel was the trap. Voss was quiet for a moment. Not the quiet of someone unconvinced. The quiet of someone running the operational logic and checking it for the places where it failed. The risk, he said, is that Pruitt doesn't just report back. If he identifies you as a threat rather than an asset to be managed, he escalates. He'll report back, she said, because the alternative is explaining to Hartwell why he didn't. Pruitt's in this because he decided cooperation was his best option. He's been making that calculation continuously since he separated from service. He's not going to change the calculation without a reason. And if he gets a reason, then we deal with that. She said it without drama, because it didn't have any. It was a risk in the way that all operational decisions contained risk, and the question was whether the expected value cleared the bar, and she thought it did. Pruitt was located by mid-afternoon, not in Portland. He'd moved, which was information in itself, the way people in compromised positions move without necessarily understanding why they're moving. He was in Delwood, a smaller city 40 miles from Harlow Falls, which was close enough that the proximity read as intentional. He was there because Hartwell needed someone with eyes on the investigation, and Pruitt was the available asset, and now he was 40 miles away in a city that put him inside the operational radius of everything that had happened in the past 4 days. Lauren drove to Delwood alone. This had not been Voss's preference. He had expressed his lack of preference in the measured language of someone who understood that expressing it too forcefully would be counterproductive, and Lauren had listened, and they had negotiated a middle ground that involved a GPS tracker under the wheel arch of her car, and Reardon in a second vehicle 3 minutes behind her, and a specific protocol for the kinds of contact that required immediate response versus the kinds that were within her operational latitude to handle. She found Pruitt at a coffee shop on Delwood's main commercial street. She did not do anything clever to find him. Ferris had used his phone's approximate location from cell tower triangulation and given her a 4-block radius, and she'd walked the radius until she saw a face she recognized. He was sitting at a window table with a coffee he wasn't drinking, looking at his phone with the distracted attention of someone whose mind was somewhere else. I was heavier than she remembered from Portland, and there was something in his posture, a compression, a caving inward, that she hadn't seen in the man she'd overlapped with for 8 months during her second deployment. She walked in and sat down across from him. He looked up. For a moment his face ran through 3 expressions fast enough that they blurred into each other: recognition, fear, and then something that was working hard to look like neither. "You look terrible," she said. He blinked. "How long have you been working for him?" she said. "I don't know what you're—" "Dale." She said his name with the flat patience of someone who had decided not to pretend. "There are federal agents 40 miles away who have a man in custody who gave them your name this morning, and mine, and Hartwell's, in that order." She watched his face. "The question is not whether this is over. The question is where you are standing when it finishes." His jaw worked. He looked at his phone on the table, a reflex, and then back at her. "Don't," she said. "Don't contact him. If you contact him right now, he'll know I found you, and the value of this conversation disappears for both of us." Pruitt set the phone face down on the table with the careful deliberateness of someone doing the first cooperative thing and needing to demonstrate that they know that's what they're doing. "I didn't know about the mission," he said. "What happened to Tate's team? I didn't know that was part of it." "What did you think was part of it?" "Supply logistics, inventory management, redirecting allocations." He said it with the specific rationalizing cadence of someone who had told himself this story many times. I was never briefed on operational impact. You redirected medical supplies from forward units. You knew where those supplies were going. I knew they were going to logistics hubs. I didn't know which. You knew, Dale. Not raised, not aggressive, just accurate. You knew what the supplies were for and what it meant for the units that didn't get them. You made the calculation that the money and the protection were worth more than that knowledge. I'm not here to litigate your conscience. I'm here because you're going to talk to the federal investigators, and what you tell them and how you tell it is going to determine whether you're a defendant or a witness. He looked at her across the table. His coffee had gone cold. "Why are you doing this?" he said. "You could have, after Portland, you could have just kept running." "I know," she said. "Why didn't you?" She thought about the question. She thought about it honestly, because Pruitt deserved an honest answer even if he hadn't done much to earn one. Because a man almost died in a hospital because of what Hartwell's operation does to the people in its way. And because I was standing in the room when it happened. She looked at him. "I'm tired of being the person who's not in the room." Pruitt looked at the table. "He's going to know," he said. "When I talk to them. He's going to know it was me." "Yes. He has—" He stopped. "He has people, not just Hartwell. The network goes—" "We know the network," she said, which was not entirely true but was true enough for this moment. "You telling the investigators what you know doesn't expose you to the network. It puts you on the other side of the wall from it." She held his gaze. "The wall goes up when you decide, not before." He was quiet for a long time. Outside, the main street of Delwood moved in its ordinary afternoon way. A woman with a stroller, a delivery truck double parked, 2 teenagers sitting on a bench looking at their phones. The coffee shop was mostly empty. "I want immunity," Pruitt said. "That's not mine to offer." "But you can tell them I cooperated." "I can tell them you cooperated," she said. "Yes." He picked up his phone. He turned it face up and looked at the screen and then set it face down again without doing anything with it. One last negotiation with himself. "Okay," he said. "Oh." The conversation with Pruitt lasted 58 minutes. She did not record it. The recording was a Reardon's responsibility, from the device she hadn't been told about but had assumed was somewhere in the room, because that was how these things worked and she had stopped expecting otherwise. By the time they left Delwood, Pruitt in Riordan's vehicle and Lauren in her own, Sikowski had 3 additional documented connections between Hartwell's logistics oversight and the specific supply chain nodes where the diversion had been occurring. What Pruitt gave them was not the full architecture, but it was the internal perspective that documentation couldn't provide. The human layer that Sikowski had identified as the missing piece, the meetings, the framing. The specific language Hartwell had used when initiating participants, which was the language of institutional efficiency and strategic reallocation, and which was, when you followed it down to its operational floor, the language of theft from the people who could afford it least. By 6 in the evening, the case file had grown significantly enough that Sikowski was using a word she'd been avoiding all day. Sufficient, she said, not triumphant, just precise. For a warrant? Voss asked. For warrants. Plural. She said it while looking at her screen, and then she looked up. We move tonight, the element of surprise is real. We wait, and the channel that Lauren provided Hartwell goes quiet, and he starts drawing conclusions about why. How long does he have before he draws those conclusions? Lauren asked. He's already drawing them, Sikowski said. The man from the break room stopped being accessible to Hartwell's network the moment we took him into custody this morning. Hartwell knows something went wrong. He doesn't know how much. Every hour gives him more information. Then you move tonight, Lauren said. Voss was already on the phone. Well, she was not in the room when they arrested Warren Hartwell. She had asked to be, and Voss had declined, and she had understood the declining even though she didn't prefer it. The arrest was a federal operation with specific protocols, and the presence of a civilian with a classified background and a complicated legal status would have been a procedural liability. She understood that. She sat in a room in the federal building and understood it for 3 hours while the operation ran. Reardon came back first, which told her it had gone without significant incident. He lawyered up immediately, Reardon said, which was expected. But there were documents in his office. Physical documents, not digitized. The kind of records that documented what was actually received versus what was logged. Yes. She thought about Tate's team going into a decommissioned base to retrieve paper records. Going in because someone in the investigation had known those records existed and known they were the kind of evidence that was hard to argue away. Going in and getting partially there, and Tate ending up on a trauma bay table gray and dying while Caldwell ordered a CT scan. Who else? She said. Riordan listed 4 names. 2 were active duty officers. 1 was a civilian contractor with deep logistics history. 1 was a senior official at the supply agency, not military, civilian government, the kind of position that didn't appear in operational briefings, but controlled the administrative systems that operational decisions ran through. Pruitt's in processing, he said. Sikowski thinks the immunity negotiation goes through. It's not guaranteed. I told him I'd tell them he cooperated. I know, I was in the car. He paused. The recording was good, clean. His counsel is going to say it was coercive. It wasn't coercive. I know that too. Courts take time. He looked at her with the direct expression of someone who was going to say something and wasn't going to apologize for saying it. Caldwell called the hospital board today. He found out the board is expanding the administrative review beyond last week's incident. There are former staff members who are being contacted about specific cases over the past 2 years. He paused. He also filed a formal complaint about you, about the way the military presence in the hospital over the past several days was handled and your involvement in it. She looked at him. He filed a complaint, she said. He's trying to make the review about procedure rather than judgment. It's a defensive move. Reardon's expression held something that was not quite contempt, but was adjacent to it. His attorney's argument is going to be that your intervention, the needle decompression, set a precedent that his subsequent administrative response was responding to appropriately. His attorney is going to argue that trying to have me removed from the trauma bay while the patient's pressure was 68/34 was appropriate. Yes. She thought about this. She thought about it with the same methodical quality she'd brought to everything else today, because thinking about Caldwell with anything more than methodology was a use of energy that the situation didn't justify. What does the board need from me? She said. A formal statement. Your account of the events of that night, documented, with your full background on record. He held her gaze. Your full background. There it was. The thing she had been running from for 3 years. The armor she had built. The careful architecture of ordinary and invisible that she had constructed because she had needed it to be constructed. It was going to be part of a hospital board record. It was going to be the thing that answered Caldwell's formal complaint. It was going to be the thing that made the clinical intervention unimpeachable, because you could not argue that a special operations combat medic with a classified commendation and 4 years of field experience had overstepped by performing a needle decompression on a crashing patient, and you could not make that argument while keeping a straight face in front of a board that had access to the full record. The identity situation, she said. Voss is handling the administrative side. Lauren Mercer remains your legal name going forward. The agency that helped you set it up is going to document it cleanly, but the background behind it doesn't stay sealed. Not for this. No, she said. I understand that. She sat with it for a moment, the armor coming off, the specific vulnerability of being fully known after years of being precisely unknown. She had expected it to feel like more exposure, more fear, more of the cold calculation she'd been running since the night in Trauma Bay 1 when she'd made the decision to step through the door. What she felt instead was something more like exhaustion, and underneath the exhaustion, something else that was harder to name, something that had the quality of ground under her feet after a long time of finding footing on surfaces that moved. I'll give them the statement, she said. The board met the following morning. Lauren gave her statement in a conference room, very different from the one where Caldwell had sat across from her 5 days ago. More people, a formal recorder, a process that moved with the weight of institutional accountability rather than the swift, self-protective efficiency of a director trying to manage a problem. She spoke for 40 minutes. She answered questions for 20 more. She described the events of that night in the same clean clinical language she'd used in the chart, and then she described the 4 years that made those events possible, and she did it without apology and without performance. Because the thing had happened and the thing had been the right thing to do, and she was not going to frame it as anything other than that. Caldwell sat across the table with his attorney on his left and a legal pad in front of him that his attorney had been writing on steadily for the first 15 minutes and had stopped writing on at some point during the description of the Fort Marek operation. Caldwell himself had stopped looking at her during the clinical portion of her account and had not started looking at her again. When she finished, the board chair, a woman in her 60s named Alderman, who had the particular quality of someone who had been making difficult institutional decisions long enough that difficulty had become a familiar texture, looked at her for a moment over the top of her reading glasses. Ms. Mercer, she said, when you stepped through that Trauma Bay door, was there any point at which you considered that the consequence might be exactly what has happened over the past week? Lauren thought about the question honestly. Yes, she said. And you proceeded anyway. The alternative was watching him die. Alderman looked at her for another moment, and then looked down at the documents in front of her. At the end of the table, Caldwell's attorney leaned over and said something quiet into Caldwell's ear. Caldwell listened. His jaw moved in the way she'd seen it move in the trauma bay, in the conference room, in the elevator doorway. The recalculation. The specific physical expression of a man revising a position he'd held with confidence that was turning out to have been misplaced. I'd like to call a brief recess, Caldwell's attorney said. Granted, Alderman said. The recess was 15 minutes. When it ended, Caldwell's attorney informed the board that Dr. Caldwell would be withdrawing the formal complaint and stepping back from the administrative review process, which was not a resolution. A board review with multiple staff witnesses and 2 years of documented cases did not end with a withdrawal of a complaint. The withdrawal just meant Caldwell had stopped fighting from the front and was now going to fight from the position of making everything as slow and expensive and procedurally complicated as possible. Lauren understood this. The attorney understood this. Everyone in the room understood this. But withdrawing the complaint meant Caldwell had looked at the full shape of what was on the table and decided his position was untenable, and that was not nothing. That was a man who had spent years managing a department by keeping the people under him too small to challenge him, looking at the full account of one of those people and deciding that challenging it was a fight he had already lost. The board chair thanked Lauren for her time. Lauren walked out of the conference room and stood in the hallway and breathed. Petra was waiting. She had not been in the meeting. She'd given her own statement the previous afternoon. But she was standing in the hallway outside the conference room with 2 cups of coffee from the break room, one of which she held out. Lauren took it. How'd it go? Petra asked. He withdrew the complaint. Petra looked at her for a moment. Then she made a sound that was somewhere between a laugh and an exhale. 14 months, she said. I watched that man move you to Overflow 11 times in 14 months. I know. And you just... Petra shook her head. Every time. You just went. It was easier, Lauren said. Until it wasn't. Petra looked at her coffee. Are you coming back? Lauren thought about the card Voss had left on the bench. When ready. She thought about Sikowski saying sufficient. She thought about Tate in the makeshift hospital room in the federal building, telling her that Lily already knew he was going to be okay because he'd told her himself that morning on the phone. She thought about Riordan, who had been a 26-year-old bleeding out in a ditch in the dark, and who had become the man in the bruised jaw who'd put a Glock in the glove box without making it a moment, and who had been in the car for 58 minutes listening to her talk Pruitt down and had not once tried to take over. I don't know yet, she said. That's an honest answer, Petra said. It's the only kind I've got right now. They stood in the hallway and drank the bad coffee, and outside, through the window at the end of the corridor, Harlow Falls was doing what mid-sized ordinary cities did on ordinary mornings, which was existing in its functional, unremarkable way without knowing that in a federal building across town, Brigadier General Warren Hartwell was sitting with his attorney, and the documents from his office were being cataloged by federal agents, and the case that had been quietly building for 14 months was now moving at a speed that nobody in Hartwell's network had correctly anticipated. Lauren's phone buzzed. She looked at it. Voss. A text, not a call. Hartwell is asking to talk, not to investigators. To you. Says he has information about the original operation that connects to your separation. Says you'll want to hear it before the charges are formalized. She read it twice. Then she read it again, because the second clause was the one that required reading more than once. Information about the original operation that connects to your separation. And the reason it required reading more than once was that she had told herself for 3 years that she'd walked away voluntarily. That the decision to disappear had been hers. That there had been no pressure, no specific threat, no event that had made staying impossible. She had told herself this story so many times that she had stopped checking whether it was accurate. And Hartwell, sitting in a federal building with his attorney and the full weight of what he was facing, was claiming to have information that would force her to check. She had told herself this story so many times that she had stopped checking whether it was accurate. She stood in the hallway of Mercy Crest, with a cup of bad coffee cooling in her hand, and read Voss's text a 4th time. And what she felt was not the cold recalibration of the past week, not the operational clarity that had carried her through the trauma bay and the federal building and the coffee shop in Delwood. What she felt was something older and less organized than that. Something that lived in the part of her that had packed a bag 3 years ago and driven out of a city at 4 in the morning and told herself it was a choice. Lauren. Petra was watching her. What is it? Nothing urgent. She put the phone in her pocket. I need to make a call. She walked to the window at the end of the corridor and called Voss. He picked up on the second ring. You saw it. I saw it. What does he actually have? We don't know yet. His attorney is managing the disclosure carefully. What Hartwell has indicated and this is his characterization, not a verified claim, is that your separation from service was not entirely voluntary, that there was an event or a series of events that were used to pressure you out. A pause. He's framing it as information he's offering in exchange for consideration on the charges. He's bargaining. He's bargaining, Voss confirmed. Whether the underlying information is real is the question. She looked out the window. Harlow Falls. The parking structure. The ordinary Tuesday morning of a city that had no idea what had been running through its institutions for the past week. I want to hear what he says, she said. Lauren, not as part of his bargain, not as something that affects the charges. I want to hear it independently, and I want it documented that whatever he tells me doesn't constitute cooperation credit. She paused. Can Sikowski arrange that? A beat. Yes. Then set it up. The room where they put Hartwell for the conversation was not the room where formal interrogations happened. It was a smaller space, a table, 4 chairs, a recording system that everyone in the room acknowledged and nobody commented on. His attorney was present. Sikowski was present. Voss sat against the wall. Lauren sat across from Warren Hartwell and looked at him directly for the first time. He was 61 years old and looked it in the way that certain kinds of sustained pressure ages a person. Not softly, not gradually, but in specific places. Around the eyes. In the set of the jaw. He was a large man who had been physically imposing for most of his life, and was now something slightly diminished from that, not from the arrest, but from something that had been happening longer. The specific diminishment of a person who has been managing a large deception for an extended period and has been spending the energy that people usually spend on other things. He looked at her for a moment before speaking. "You don't remember me," he said. "I remember you, Joint Command Briefing. You were a colonel." Something moved in his face. Not surprise, more like the confirmation of something he'd expected. "You were the medic attached to Bravo Element. You were in the third row." "Yes." "I asked your CO about forward medical asset deployment. He gave you a wrong answer and you didn't correct him." Hartwell was quiet for a moment. "I want you to understand something," he said, "before I tell you what I know. I'm not telling you this because I think it changes what I did. I'm telling you because the people who pushed you out are still in positions where they can do it again to someone else. And that bothers me more than the rest of it, which I recognize is a convenient thing to say from where I'm sitting." "Tell me what you know," she said. "I'll decide what it means." He folded his hands on the table, a gesture that would have read as composed in a different context, and now read as a man trying to locate something steady to hold on to. "In the last year of your service," he said, "you filed an informal report, not through official channels, through your unit's internal system, about a supply discrepancy you'd observed. Medical inventory that was logged as delivered to your forward position that you could not account for in physical stock." She went still. She remembered this. She had filed that report and received a response. Administrative, bureaucratic, the kind of response that said noted, under review, and produced nothing visible. And she had followed up twice and received the same response, and had eventually concluded that the discrepancy was either too small to matter or had been legitimately resolved through some accounting process she didn't have visibility into. "That report went to your unit's logistics officer," Hartwell continued, "who forwarded it, through channels I was involved in managing, to someone who understood exactly what it meant. Not the discrepancy itself. The discrepancy was minor in the scope of what was happening at that time. What mattered was that a combat medic in a forward unit had noticed, had documented it, had followed up." He paused. "You were not the first person to notice, but you were the most persistent, and you were in a position where your specific access and your specific skill set made you a liability if you continued asking questions. So someone pushed me out," she said. "It was managed carefully. Your record was clean, too clean to manufacture a cause. What they did instead was make the environment untenable. Reassignments that disrupted your unit cohesion. A CO who suddenly became unavailable. Evaluations that were technically accurate but calibrated to make forward deployment renewals complicated." He looked at her steadily. "It was slow. It was designed to feel like institutional friction rather than pressure. You were supposed to conclude that the military bureaucracy had run out of room for you and leave on your terms." "And I did," she said. "And you did." The room was very quiet. She thought about the last 8 months of her service, the texture of that period, the way things that had worked stopped working, the way support that had been reliable became unreliable, the way she had gradually and rationally concluded that the life she'd built in the service had run its course. She had grieved it with the efficiency she brought to everything, thoroughly, privately, and then she had moved forward. She had thought it was her choice. "Who," she said, "above me?" Hartwell said it without hesitation, which meant he'd decided before he came into this room that this was what he was giving them. "There are 2 names. One is retired now. One is currently serving in a senior advisory role at the joint level." He looked at Sikowski. "My attorney has the documentation." Sikowski looked at Voss. Voss's expression had not changed since Hartwell started talking. That particular controlled stillness that Lauren had learned to read as the opposite of calm, as someone managing a significant internal response with practiced efficiency. "The documentation is sufficient for a referral?" Voss asked. "More than sufficient," Hartwell's attorney said, which meant he'd reviewed it, which meant this part of Hartwell's offer was real. Lauren looked at Hartwell. She looked at him for a long time, at the diminished largeness of him, at the hands folded on the table, at the face of a man who had built a 26-month operation on the diversion of resources from the people least positioned to survive without them, and who was now offering up the people who had done the same thing to her as a bargaining chip. "You should have given them this to begin with," she said. "I know. Not to investigators. You should have given them this instead of doing what you did, before any of this." He looked at her. "Yes," he said, and then quietly, "I know." She stood. She looked at Sikowski. Whatever consideration his attorney negotiates, that's between them and the prosecutors. I don't have a position on it. She picked up her bag. "I have what I came for." She drove back to her apartment and sat in her car in the parking structure for a while, not because she needed to, but because the apartment felt like a specific kind of destination, and she wasn't quite ready for it yet. 8 months of her life had been managed. The reassignments that felt like bureaucracy, the CO who became unavailable, the evaluations calibrated to close doors, all of it constructed to move her out of a position where she was asking questions that someone needed her to stop asking. She had been outmaneuvered not by force, but by the patient, precise application of institutional friction, and she had been outmaneuvered so smoothly that she had left believing it was her own conclusion. This was the thing she sat with. Not the anger. The anger was there, a clean and legitimate anger, but she knew what to do with anger, and it wasn't sitting in a parking structure. What she sat with was the more complicated thing underneath the anger, which was the recognition that she had spent 3 years building armor against a threat she had never correctly identified. She had been running from the exposure of her identity when the thing she should have been running toward was the thing she had noticed and documented and followed up on twice and been efficiently redirected away from. The supply discrepancy report, filed in a unit internal system, forwarded to someone who understood exactly what it meant. She had been a threat before she knew she was one. She got out of the car and went upstairs and made coffee that was better than the hospital break room coffee, which was not a high bar, and stood at the kitchen window and watched Frank on his balcony with his birds. After a while, she picked up her phone and called Voss. "The 2 names Hartwell gave," she said. "We have them. The retired one is a straightforward referral. The one currently serving is more complicated. Senior advisory roles have insulation around them. But the documentation Hartwell's attorney provided is enough to start the process." He paused. "It will take time." "I know. How are you?" She looked at Frank adjusting the feeder tray with the focused attention of someone for whom this moment was complete in itself. "Working on it," she said, which was what she'd told Petra 2 days ago and was still the most accurate answer available. "The consultancy position," Voss said. "It's still on the table. It's been on the table. I didn't want to press." "I know you didn't." She thought about it. Not for the first time. She'd been thinking about it in the margins of everything else for the past week. "Tell me again what it looks like, specifically," he told her. She listened this time with a different quality of attention than the first time he'd described it. Not the attention of someone evaluating an escape route or assessing a risk, but the attention of someone trying to determine whether a thing fit the actual shape of their life rather than the shape they'd been maintaining out of habit. Joint Medical Training Program. Special Operations Units. Developing trauma capability in the field and building the bridge between field medicine and civilian clinical systems. Flexible structure. Civilian life maintained alongside it. Identity situation resolved and documented. And this, the chance to ensure that what had happened to supply chains and forward units, the diversion of what soldiers needed to survive because people with authority and access had decided their need was less important than other priorities. The chance to be in a position where she was looking at those systems rather than away from them. "Yes," she said. Voss was quiet for a moment. Yes, as in, I'll take the position." She drank her coffee. "I need 3 weeks to sort out my situation here. The board review, my apartment, some things I need to finish. 3 weeks is fine. And I want it in writing that my clinical work at Mercy Crest during the consultancy is my own decision. I'm not trading one institution's authority for another. That's already in the structure." "Then yes," she said again. She hung up and stood at the window for a while longer, and then she called Petra. "I'm coming back for the last 3 weeks of my contract," she said. "Then I'm leaving." Petra was quiet for a moment. "Leaving? Leaving. Another pause. "Okay?" And then, Are you going to be okay? Yeah, she said, and meant it, which was different from the last several times someone had asked that question. The board's formal findings came out 9 days later. Aldermen read them in a meeting that Lauren was not required to attend, but attended anyway, because the findings were going to enter the institutional record and she wanted to be in the room when they did. The findings documented a pattern of clinical scope restriction by Dr. Preston Caldwell that had, over a period of approximately 22 months, demonstrably limited patient care quality in the emergency department. 11 specific instances were cited. The needle decompression performed on a patient in acute hemodynamic compromise was found to have been clinically appropriate, medically justified, and consistent with emergency necessity doctrine. The attempt to have the performing nurse removed from the trauma bay during an active resuscitation was found to constitute a material failure of clinical leadership. Caldwell's administrative leave was formalized as a suspension pending a full review by the state medical board. His ER director position was eliminated. His clinical privileges were restricted pending the state board's findings, which were expected to take several months, in which, based on what Sikowski had heard from the board's legal team and passed to Lauren through Voss, were not expected to be favorable. It was not a satisfying collapse because no collapse is satisfying when you're standing close enough to see all the parts of it. Caldwell was not a cartoon. He was a man who had built his professional identity around authority and had defended that authority so reflexively and for so long that he had stopped being able to distinguish between protecting his authority and doing his job. He had looked at Lauren Mercer for 14 months and seen a temporary nurse who could be efficiently managed, and he had been wrong in a way that the institutional record now documented clearly and permanently. She didn't feel triumph. She felt something more tired and more honest than triumph. The particular feeling of a thing that should have been different from the beginning finally being named as different, which was justice of a kind, but not the kind that returned anything to the people who'd needed it when it was still preventable. She thought about the 11 specific instances in the findings. 11 patients, over 22 months, whose care had been limited by a director more interested in the hierarchy than the outcome. She thought about how many of those 11 people knew, or would ever know, that a finding existed. Most of them wouldn't. Most of them had moved through their medical crisis and continued their lives without knowing that the system that was supposed to protect them had been running with a particular kind of dysfunction, and the dysfunction had been named, and the naming had come at the cost of a week that Lauren Mercer, Nora Vance, would spend some time processing and then would incorporate into the rest of her life and keep moving. That was how it worked. She had learned this in the field and relearned it in the hospital and was relearning it again now. Justice was not a destination you arrived at and stopped. It was a thing you did continuously, or it stopped being done. She left the meeting and walked to the ER. Petra was at the charge station, which was where Petra usually was. She looked up when Lauren came through. How'd it go? It went, Lauren said, which conveyed what it conveyed. Petra nodded. Bay 3 has a laceration that needs irrigation and closure. The resident who was supposed to take it got pulled to a trauma. You want it? Yes, Lauren said. She changed into scrubs, washed her hands, and went to Bay 3. The patient was a man in his early 50s named Gerald, who had caught his palm on a fence post and was trying to be stoic about it in the specific way that middle-aged men tried to be stoic about things, which was to say, not very effectively, but with commitment. The laceration was about 4 centimeters, ragged at one edge, not deep enough to threaten the underlying structures but needing proper attention. She examined it, explained what she was going to do, and then did it. Local anesthetic, irrigation, closure in layers. Gerald talked throughout, about the fence, about the project he was building in his backyard, about his daughter who was in her first year of college and had called him last night for the first time since move-in day, and he was trying to act like that hadn't been the best part of his week. It was obviously the best part of your week, Lauren said. Gerald laughed, which moved his hand slightly, which she adjusted for without commenting on. My wife says I'm terrible at hiding things, he said. She's right, Lauren said. She finished the closure and dressed the wound and gave Gerald the aftercare instructions in the clear, complete way she always gave instructions. Not rushed, not condescending, covering the things that patients forgot, and then came back for because nobody had told them properly the first time. He looked at his bandaged hand and then at her. Thank you, he said. It was uncomplicated. He meant it without ceremony. Take care of the fence project, she said. She walked him out and went back to the charge station and picked up the next chart. This was the work. This had always been the work. The specific, unremarkable, consequential work of being present with people in the moments when their bodies had failed to cooperate with their plans for the day. It was not glamorous. It was not the thing that looked significant from the outside. It was a 4-centimeter laceration on a man who was proud of his daughter and building something in his backyard, and she had closed it carefully and told him what to watch for and meant it, and that was what the work was. She had spent 3 years trying to make herself small enough that no one would look at her, and the smallness had not made the work smaller. The work had stayed exactly the size it was. She was the one who had gotten smaller around it. She was not going to do that anymore. Marcus Tate came to the hospital on her last day. Not as a patient, he was outpatient now, walking with the careful deliberateness of someone whose core hadn't fully reknit, but who was not going to let that be a reason to stay still. He was in civilian clothes, which looked slightly foreign on him, the way civilian clothes sometimes looked on people whose bodies had been shaped by years of a different kind of requirement. He found her at the charge station at the end of the afternoon shift. "I wanted to come before you left," he said. "You didn't have to." "I know." He looked around the ER with the expression of someone who was seeing a place differently than they'd previously understood it, knowing now what had happened here in this specific room, in a way that he hadn't known while it was happening to him. "Reardon told me about Hartwell, about your separation. It's part of the record now. Does it change anything for you?" She thought about the question honestly, because Tate was the kind of person who asked questions he wanted honest answers to rather than comfortable ones. "It explains things I thought I already understood," she said. "That's not the same as changing them." She paused. "The 3 years I spent as Lauren Mercer, the work I did here, I don't want to write that off as 3 years I was hiding. I was also working. I was also doing this." She gestured at the ER around her. "I'm not going to decide that it didn't count because the circumstances were wrong." Tate looked at her for a moment. "Lily wants to meet you," he said. She blinked. "I told her a woman helped me come home. She wants to know who." He said it simply. "You don't have to. She's 7 and she'll move on to the next thing in about 48 hours. But she asked, and I said I'd ask you." Lauren thought about a 7-year-old who'd been told her father was going to be okay, who'd heard it from him, on the phone, in the morning. "Yeah," she said, "I'd like that." Something in Tate's face did the complicated brief thing she'd seen before and then settled. "Reardon also wanted me to tell you something," he said. He stopped. Started again with the slight precision of someone quoting carefully. He said he still remembers the road trip, the one you described. He knows it wasn't real. She looked at him. "He said he drove the route anyway," Tate said. "Last spring. Said it took about 4 days." A pause. "Said it was a good route." She looked at the floor for a moment. Just a moment. "Tell him I said good," she said. She cleaned out her locker on a Thursday morning, which felt right in the arbitrary way that certain moments feel right, because the alternative is that nothing feels like the right time and you have to pick something. Her locker held a spare set of scrubs, a granola bar she'd forgotten about, a phone charger, a small photograph she'd taped to the inside of the door 3 years ago and had not thought about consciously in months, but had apparently needed to be there. The photograph was of a hillside, no people in it. Just a hillside with dry grass and a specific quality of late afternoon light that she had been standing on the day she decided to become a medic, at 22 years old, when she had understood something about herself that she hadn't had words for yet, that she was the kind of person who moved toward the thing that was wrong rather than away from it, and that this was not a flaw she needed to correct, but a direction she needed to follow. She'd spent 3 years running away from that direction. She put the photograph in her bag. Petra was waiting in the break room. She had made coffee that was slightly less bad than usual, which was the maximum effort the equipment allowed. "There's a card," Petra said, "from the floor. People signed it." Lauren looked at the card on the table, standard hospital gift shop variety, with a generic sentiment on the front that whoever bought it had chosen for its blankness rather than its specificity. Inside, signatures. 21 of them, nurses, techs, the 2 residents she'd worked alongside, the charge nurses who'd scheduled her for 14 months, Gerald had somehow found out she was leaving and added a line in handwriting that was unmistakably the handwriting of a man who built things, large and slightly crooked and completely sincere. She read it. She didn't perform not being moved by it, because she was moved by it, and performing otherwise would have been an insult to 21 people who had signed their names. "Thank you," she said. "Don't thank me," Petra said. "I just held the pen." Petra. "What?" "You called me when you didn't have to. When the military people were in the building and things were happening you didn't understand, you called me and told me what you knew because you thought I should know it." Lauren looked at her. "That mattered. I want you to know that specifically." Petra looked at her coffee cup. She had the expression of someone who was receiving something they'd decided in advance not to make a large thing of, and was finding the decision harder to execute than anticipated. "Well," Petra said, "you're a good nurse." "You too," Lauren said. They drank their coffee. Outside, the ER did what ERs do at every hour of every day, moved and adjusted and received whatever the world sent through its doors, without ceremony and without pause. The continuous work of people who had decided to be present at the moments when presence was most required. The consultancy started on a Monday. The office Voss had arranged was not an office in any conventional sense. It was a workspace in a joint facility outside Harlow Falls, functional and spare, with a whiteboard and a table and a window that looked out over a training field where she could see, on the first morning, a group of medics running a scenario that she could read from the window as a penetrating trauma simulation. She watched them work for a while before she set anything down. They were doing something wrong with the airway management. She thought about whether to go out there, and then she went out there because she had stopped talking herself out of going toward the thing that needed addressing. The instructor, a staff sergeant named Briggs, who was approximately 30 and had the specific look of someone who was good at what he did and knew it without being obnoxious about it, turned when she walked up. Assessment, quick. The civilian clothes, the lack of insignia. "Can I help you?" he said, which meant "Who are you and why are you on my training field?" "Your casualty is going to aspirate," she said. "The positioning on the airway adjunct. You've got the angle wrong for a patient who's already compromised on the left side. You're going to drive the problem deeper." Briggs looked at her. He looked at the scenario. He looked at her again. "Show me," he said. She showed him. She spent 40 minutes on the field with his team, working through not just the airway issue, but 2 other procedural patterns she'd identified while she was out there. Because once you started looking at the things that needed addressing, it was difficult to apply a selective blindness to the rest. Briggs watched the whole thing. He asked questions that were good questions. Specific, procedurally precise, the questions of someone who was there to learn rather than to defend what they already knew. His team asked their own questions. Lauren answered all of them. When it was done, she walked back toward the building. "Hey," Briggs called. She turned. "You're the new consultant," he said. It wasn't a question. "Yes." "Voss didn't tell us much about you." "What did he tell you?" Briggs considered. "That you've worked in conditions where getting it wrong meant someone died, and that you'd tell us when we were getting it wrong." He paused. "He said you were good at that." "I'm working on it," she said, which was the truest version of any claim she could make about herself, and which she had decided to stop treating as a lesser answer than yes. She went inside and sat at the table and opened the first file Voss had sent her, a review request for a training protocol used across 4 SOCOM-adjacent units, flagged by a medic who had noticed a discrepancy between the protocol and the field conditions it was supposed to address. The medic who'd flagged it was a specialist named Wren, 24 years old, 8 months in the field, working through the unit internal reporting system because that was the correct channel and no one had told her the correct channel wasn't working. Lauren read the discrepancy report carefully. Then she picked up her pen and started writing the response that Specialist Wren deserved. Not the administrative acknowledgement, not the noted, under review that went nowhere. The response that said, "I see what you saw. Here is what we're going to do about it." She wrote for an hour. When she finished, she sat back and looked at the window and the training field beyond it, and the medics who were running another scenario, adjusted now, doing something closer to right than they'd been doing an hour ago. Here was what she had learned across the specific hard education of the past 3 years and the 4 years before them, and the week that had changed the shape of what came next. Being underestimated was not a wound you carried. It was information. It told you something about the room you were in and the people in it, and the distance between what they saw and what was actually there. And the distance was not the problem. The distance was the operational space. The people who had managed her out of her service had underestimated the thing they were trying to contain. They had seen a medic filing a supply discrepancy report and had managed the medic without addressing the discrepancy, which was the error that every person who had tried to keep Lauren Mercer small in one way or another had eventually made. They had addressed the visible surface of what she was doing without reckoning with the reason she was doing it. She was not someone who filed reports and then stopped caring about the answer. She had never been that person. The armor she had built was real. She had needed it, and it had held, and she was not going to pretend that 3 years of careful, invisible work had been a waste because the circumstances were wrong. She had closed lacerations and managed GI bleeds, and talked teenagers through panic attacks and started IVs on difficult sticks. And every single one of those things had mattered to a specific person in a specific moment. And that did not stop mattering because the context was complicated. But armor was for surviving. It was not for living. She had been surviving. She was done with that. 3 months later, a federal grand jury indicted Warren Hartwell on 14 counts. The 2 names he had given, the ones who had constructed the institutional pressure that pushed Nora Vance out of her service, were the subject of a separate referral that moved through channels more slowly, because the channels that governed senior advisory roles moved slowly by design and by the preference of the people who occupied them. They moved. They just moved slowly. Hartwell's plea negotiation took 2 additional months and produced a sentence that his attorney called reasonable and that Sikowski, in a brief text to Lauren that she sent on the day the plea was entered, described as not nothing. Dale Pruitt received conditional immunity. The conditions were significant. He met them. Preston Caldwell's state medical board review concluded with a formal censure and a 2-year probationary period with mandatory supervision. His privileges were reinstated in a limited capacity that bore no resemblance to the ER director position he had occupied for 7 years. The Mercy Crest board hired a new director who had, as her second week's action, met with every nursing staff member individually and asked what they needed. Lauren heard about this from Petra, who texted her a single line. She actually listened. Lauren texted back, "Good," and meant it without residue. Reardon sent her a photo of a highway sign from somewhere in the eastern part of the state, the kind of sign that appeared on empty roads in October with golden grass on both sides and a quality of light that a person didn't manufacture. No message, just the photo. She saved it. Marcus Tate passed his 6-month medical clearance with no complications except a residual stiffness in his left side that his surgeon said would resolve, and that Tate, who Lauren had come to understand as someone who applied the same practical patience to his own body that he applied to everything else, was not concerned about. He returned to limited duty. He called Lauren once, briefly, to tell her, and she said she was glad. And she was. Lily, it turned out, had strong opinions about how the meeting should go. She had decided that she wanted it to happen at a park and that there should be dogs present. And since Tate was a man who had learned to navigate the non-negotiable requirements of a 7-year-old with the same respect he gave operational parameters, there were dogs present. 2 of them, belonging to a neighbor who had been recruited for the occasion. Lily shook Lauren's hand very formally and then immediately showed her which dog was her favorite and why. Lauren crouched down and let the dog investigate her hand and thought about the 4 hours in the dark at Fort Marek and the 90 seconds in Trauma Bay 1 and the morning in the consultation room watching the clock and all the distances between those moments and this one, and decided that the distances were the story rather than the interruption of it. "He's the good one," Lily said, referring to the dog. "The other one is okay, but this one's the good one." "He seems like the good one," Lauren agreed. Lily looked at her with the direct, undisguised appraisal of a 7-year-old who had not yet learned to soften her assessments. "My dad says you're really good at your job," Lily said. "I try to be." "He says you're better than you think you are." Lauren looked at Tate over Lily's head. Tate looked back at her with the expression of a man who was not going to rescue her from a conversation with a 7-year-old who had inherited his directness. "Tell your dad," Lauren said, "that I'm working on it." Lily relayed this with great seriousness, and Tate nodded, and something passed between them. Not the compressed military communication of 2 people who had been through something together, but something quieter and more ordinary than that. The acknowledgement between two people who both understood, from different angles, what it cost to keep going toward the hard thing rather than away from it. The dog pushed its head against Lauren's palm. She scratched behind its ears. The afternoon held them all: the park, the October light, the two dogs, a man who was alive and his daughter who intended to remain unimpressed by that fact in the specific way that children are unimpressed by things they've decided are simply the baseline of how the world should work, which was not the worst way to look at it. Nora Vance had been a soldier. Lauren Mercer was a nurse. She was both of those things, and neither of them was a cover for the other, and the life she was building now was not the one she'd planned, and not the one she'd run from, and not the armor she'd worn for 3 years in a city where nobody knew her name.